We're starting in less than 1 minute, 45 seconds. We should be starting. Be ready, everybody.
Thomas, can I have your mic checked?
Yes, please. Do you hear me well?
Perfectly well, sir.
Thank you very much.
Have everyone to mute for the moment.
Okay.
5, 4, 3, 2. Ladies and gentlemen, may I have your attention? The summit is about to begin.
A very good afternoon, honorable greetings, and a very good afternoon to honorable ministers, distinguished guests, ladies and gentlemen. We take great pleasure in welcoming you to the first ever Leaders Web Summit, redefining the role of media in the new norm. I'm Philomena Pragasam, Director of the Asia Pacific Institute for Broadcasting Development. And before we move on, let's reflect and observe a moment of silence for the lives lost in the pandemic. We have lost more than 3 million people of COVID-19 globally. So let's take a moment of silence to commemorate these people who have left us. Thank you. So welcome once again to our two-day web summit, joined by dignitaries, industry leaders, and broadcasters from over 40 countries. Today, we're joined by more than 200 members from across Asia, Pacific, Africa, Europe, and a whole lot of other countries as well. So this global event is also being streamed live on Facebook. And today also, we're joined by the president of the AIBD GC, Mr. Mayank Agrawal from India, and Vice President, Mr. Rizal Aputedera from the Philippines. And without much ado, I would now like to invite the Honorable Minister of Information, Cambodia, His Excellency, Dr. Khieu Kanharith, to deliver his welcoming remarks. But before that, let's just look at Dr. Khieu. He is a well-known figure and Minister of Information in the Kingdom of Cambodia since 2004. He has served as an advisor on the Council of Ministers, was also an official spokesman for the United Nations Transitional Authority in Cambodia, UNTAC. And in 2020, His Excellency was conferred the honorary doctorate in liberal arts from Raja Mangala University of Technology, Pranakhon, RMUTP. I now take great pleasure in calling upon His Excellency, Dr. Khieu Kanharith, to deliver his welcoming remarks. Welcome, Dr. Khieu. Thank you.
Thank you, Philo. Good afternoon, everybody. Excellency Minister, Vice Minister, Madam Under Secretary General, Executive Secretary of UN-ESCAP, distinguished speakers and guests, ladies and gentlemen. It's my great pleasure and honor to deliver the opening remark at the inaugural Leader Web Summit on redefining the role of media in the new norm, initiated by the Asia Pacific Institute for Broadcasting Development, AIBD, today. I would like to take this opportunity to welcome all the wonderful speakers and delegates attending this virtual summit at a time when so many regions are going under lockdown and so many countries are reporting high incidents of the new wave of COVID-19 pandemic. Taking this opportunity on behalf of the Royal Government of Cambodia, I would like to present my deepest condolences to the loss of life of the people in our region caused by the disease, and my sincere respect to those who are sacrificing their life, their time, and their resources in combating this world pandemic. As we all have seen, the spread of COVID-19 has affected almost all aspects of human life, and for our field of information, the information system, which serves as a key to the pandemic response. An adequate information system could timely provide immediate, expeditious, and coordinate data access and sharing. It would facilitate the prioritization of care, access, and response, especially for regions and people in conditions of vulnerability. The summit lineup of sessions from the ministerial talk on media role in dissemination of information on the pandemic that will follow the opening ceremony, as well the topical session to be held later today and tomorrow will hopefully shed light on this issue. In the media landscape, the habits of consumption have shifted to the increase in audiovisual and online media consumption due to the facility of access to internet connection. But here in Cambodia, we also note a certain return to the traditional media as a compass to find a way in the flood of daily information. So we must concentrate our effort in the production of information and entertainment content, and in the same time using all internet means of communication to spread the message to the public. The COVID crisis has highlighted the lack of more efficient structure and processes necessary in the digitalized society. At the same time, seeing the upward trend that are shown by traditional media in many countries, and which is also an inexpensive resource for many families, there is a need for capitalization and revitalization of traditional media to ensure its continuity in the present status. The Leader Web Summit will hopefully allow the participants to see the unique opportunity created by the global crisis, learn about refined approaches to leadership, and share knowledge on how to move forward while adapting to the new norm. It's kindly to note that since the onset of COVID-19, AIBD has continued to deliver vital information and has achieved great success in terms of issues, discussed content, and participation. Some of the topics deal with which were safety for journalists, gender mainstreaming, data visualization, reporting on health crisis, and vulnerable group etc., etc. In this respect, I congratulate AIBD for coming up with the Health Communication Manual, which aims to train journalists on health reporting with special emphasis on COVID-19. More than 100 journalists from 46 countries have been trained so far. Media has a crucial role to play in disseminating the right information to the mass. Finally, I would like to wish you all to have a great learning and sharing in this two-day meetings, web summit with great success for everyone. Now I would like to announce the late web summit on redefining the role of media in the new norm officially open. Thank you.
Thank you, Your Excellency, Dr. Khieu Kanharith, for your heartwarming support to AIBD. Thank you so much. AIBD has hosted, Cambodia has hosted AIBD's flagship Asia Media Summit in 2019 in Siem Reap. And that was a fantastic event where we also came out with the document on disinformation, the Angkor Initiative. And this was due to the support of the Honorable Minister, Dr. Khieu Kanharith. We thank you. And the Kingdom of Cambodia is also the chair of the AIBD Executive Board. So thank you once again. And now we move on to a special keynote address by the Undersecretary General and Executive Secretary of UN-ESCAP. And we're talking about none other than Her Excellency, Ms. Armida Salsiah Alisjahbana. Now, I had the pleasure of meeting her personally, and she has done wonders for the Asia-Pacific region, and we're so happy to have her here today. Ms. Armida was appointed Executive Secretary of the United Nations Economic and Social Commission for Asia and the Pacific since 2018, and she has been involved in various research projects and consultancies at the United Nations University, the World Bank, the Department of Foreign Affairs and Trade in Australia, and the Australian Agency for International Development, the European Commission, and the International Labour Organization, ILO. And Her Excellency was awarded the Mahaputra Adi Pradana Order from the Republic of Indonesia, the Honorary Brevet from the Indonesian Navy, an Honorary Flight Wing from the Indonesian Air Force. And we are honored and proud to have the presence of Her Excellency, Ms. Armida Salsiah Alisjahbana, to deliver the keynote address. Excellency, thank you.
Thank you very much, Philomena, for your kind introductory remarks. Very good afternoon from Bangkok, Excellencies, Ministers, AIBD President, AIBD Vice President, AIBD Director, Philomena, ladies and gentlemen. It is indeed a pleasure to join you today at this very timely event on redefining the role of media in the new norm. The COVID-19 pandemic has triggered a once-in-a-century catastrophe, widening development fault lines through its disastrous impact on the most vulnerable groups of our societies. Coupled with the worsening threat of climate change, these twin crises are reason enough why we need to place the 2030 Agenda for Sustainable Development, or SDGs, and the Paris Agreement on Climate Change at the heart of the recovery efforts as we transition to a more inclusive, resilient, and low-carbon economy. To achieve this, the media can be our partner in helping us to report on COVID-19 recovery packages that tackle the climate crisis and address the root causes of poverty, inequality, and hunger. May I take this good opportunity to offer 3 principles for how the media can assist us to help back to build back better or in the recovery effort. First, we need to report the news accurately and honestly. Upholding independent, fact-based reporting is an essential global public good, critical to building a safer, healthier, and more sustainable recovery. COVID-19 is not just a major public health emergency, it is also a communication crisis. We have seen how misinformation spreading across digital channels can hamper the public health response or the effectiveness of the public health response. Media outlets must provide effective and accurate reporting as the public turns to digital platforms for credible news, particularly on governmental plans to tackle the pandemic and treatment strategies, for example, on this vaccination plan or program across the community. As United Nations, if I may quote or refer to our Secretary General, Antonio Guterres, has rightly said that we need to, quote, flood the internet with facts and science while countering the growing scourge of misinformation, a poison that is putting even more lives at risk, end quote. Secondly, we must ensure that citizens have access to information. To do this, we need to accelerate digital transformation in Asia and the Pacific. It is very difficult or hard to imagine that during the pandemic, if you have no access to the digital world. But sadly, this is the reality for over almost half of our population in our region, among whom are some of the most vulnerable. They do not have adequate or sufficient access to internet. For example, some 20% of students in East Asia Pacific and almost 40% of students in South and West Asia could not access remote learning this past year. This will have lasting effects that perpetuate intergenerational inequality and poverty. To address the digital divide, our Asia Pacific Information Superhighway initiative focuses on 4 pillars: infrastructure connectivity, efficient internet traffic and network management, e-resilience, and affordable broadband access for all. But internet access alone is not enough. There is a persistent and still expanding digital skills gap in our region. In response, our Asia and Pacific Training Center for Information and Communication Technology, this is one of our regional institutes, is working with policymakers and women and youth to equip them with digital skills needed through demand-driven training programs. And this brings me to my third and last point, which is we must promote good governance. Social media is a powerful communication platform used in many areas, from public administration to environmental protection to disaster management. But to reap the full benefits, we need to better understand the implication of social media on national policy and program formulation, and how it can be leveraged to create an enabling policy environment for digital transformation. At ESCAP, we are working to build this technical capacity, particularly in the least developed countries. Just to give you an example, last month, we brought together policymakers and media officers across ministries in Bhutan to share best practices at a virtual briefing on social media and emerging technologies for the post-pandemic world. Excellencies, colleagues, ladies and gentlemen, in closing, the media provides enormous potential to share knowledge, promote good governance, and provide access to information for all. As a regional platform, AIBD can encourage dialogue and cooperation in our region's media, highlighting important and emerging global, regional, and national issues. AIBD members can amplify the messages contained in, for example, in ESCAP research and analysis, policy advisory services, and capacity building to support the development ambitions of 53 member states in our region, from the Fiji Broadcasting Corporation in the Pacific to Radio Television Malaysia in Southeast Asia. The media has a critical role to play in modern public life, especially as we move towards a more digital, more mobile, and more platform-dominated media environment. But as we live in this rapidly changing world, we need to ensure that digital transformation happening around us does not become another facet of the deep inequality in Asia and Pacific. This is one of the greatest challenges we have to face as countries start to rebuild. That is why inclusion must be at the heart of digital transformation if we are to leave no one behind. I'm very much encouraged to see the engagement of leaders from governments, media industry, health experts, and technology gathered at the summit to discuss these critical issues to ensure sustainable recovery for our region. I wish you well and success in your deliberation. Thank you very much.
Thank you, Your Excellency, Ms. Armida Salsiah Alisjahbana from UN-ESCAP. We're so happy to have you here today, and I think you have given us a wonderful sharing on inclusivity and the role of media on how it can actually bring nations together. And we're happy today that we're joined by policymakers. So I hope that all of us can take a concerted action and build back better, and perhaps media can also look at the opportunities to connect and look at the Agenda 2030, which is surely something that we should all look at and develop. And before we move on, we're going to ask all of you to pose for a picture. And this is something that we'll all take a nice smile now. So can I have all the excellencies? Shall we take a photo now?
Yes, please.
Review? Yes.
All right. So the count of 3. 1, 2, 3. Thank you very much.
Thank you to everybody. Thank you, Excellencies, Your Excellency, Dr. Khieu Kanharith and Ms. Armida Salsiah Alisjahbana. Thank you for that wonderful opening remarks. And now we move on to a very important session today, the ministerial session. And we're truly blessed to have 5 ministers of information joining us. And this is really exciting because we also have a star moderator. We are happy to have Mr. Tomas Lamanauskas here with us today. And Tomas is coming all the way from London. And I think it's pretty early, Tomas. Good morning to you. And he's the managing partner of Envision Associates, a public policy, regulatory, and strategy advisory firm. And his experiences in telecoms and digital policy and policy regulation strategy, and he has held positions including member of the board, CEO, and Deputy General Director of National Communications Regulatory Authorities in Europe, the Middle East, and the Caribbean. And he's also a senior government advisor on information and communications technologies policy in the Pacific. And Tomas has served as head of corporate strategy, special advisor for crisis strategy, COVID-19, and partnership initiatives for the International Telecommunication Union. And he happens to be the group director, public policy at Beyond, a multinational technology and communications company. And we'd also like to wish him the best. Tomas Lamanauskas is a candidate running for the position of Deputy Secretary General of the International Telecommunications Union. Tomas, we wish you the best. And right now, I hand over the ministerial talks, media's role in dissemination of information on the pandemic to my colleague, Tomas Lamanauskas. Tomas, the floor is yours. Thank you.
Thank you very, very much, Philo. Thank you very much for this kind introduction. And it's really an honor and a pleasure to speak with this opening and keynote remarks, which already set, I think, very well the ground for this Web Leadership Summit. And it's my pleasure today to moderate this panel of distinguished ministers. And so, Your Excellencies, indeed, information is, especially accurate information, has been crucial in this pandemic. It's been crucial to take right measures to protect lives. It's been crucial to prevent proliferation of fake cures. It's been crucial to avoid scapegoating and fear. And being from telecommunications sector, I know very well how 5G networks, for example, was considered a culprit of COVID-19, and even networks face attacks. It's been crucial for business to access the help available, and especially now also it's been crucial to get accurate information on vaccines, whether to vaccinate, how to vaccinate, and where to do so. And as our keynote speaker noted, infodemic of fake information and misinformation, this flood of misinformation has been a major issue. And it was great to hear our keynote speaker to quote UN Secretary General Antonio Guterres. I also have this quote. I was afraid for a minute it'll be the same quote, but thankfully our Secretary General has a lot of quotes in this regard. So he also said that our common enemy is COVID-19, but our enemy is also an infodemic of misinformation. And to overcome the coronavirus, we need to urgently promote facts and science, hope and solidarity over despair and division. So in the current world of fragmented flood of information, trusted sources become ever more important. And information, trusted information, is a crucial tool in combating this pandemic. Therefore, it is clearly critical for the governments that trusted media plays its role in providing accurate information. And today we have 5 ministers, and we'll hear from honorable ministers on how their governments are working towards enhancing the role of the traditional media in ensuring that their citizens receive accurate information in the times when access to such information is literally a matter of life and death. So I'll introduce ministers one by one as I'll invite them to speak, and at the end we'll have opportunity as well to answer some questions. But also wanted to note that we'll have with us today in this session the distinguished rapporteurs, Dr. Ismail Shah from ITU and Mr. Rabi KC from Nepal, who will take notes of the session. I'll be able to report at the end of the today on the session. So first of all, so thank you again for this opportunity. And first of all, I would like to, I will be passing the floor to His Excellency, Dato Saifuddin Abdullah. The Dato Saifuddin Abdullah is the Minister of Communications and Multimedia of Malaysia. He also served previously as Minister of Foreign Affairs and Deputy Minister of Higher Education. And during his tenure as Minister of Foreign Affairs, he authored the foreign policy framework of the new Malaysia in 2018, which served as Malaysia's key foreign policy blueprint. He has also published 8 books, the latest of which being New Politics 2.0, Multiracial and Moderate Malaysian Democracy. He is also as a columnist in several publications. So Minister, the floor is over to you to hear from you how your government, how Malaysia is promoting the trusted information and availability of trusted information in this crucial times of pandemic. Please, Minister.
Yeah, Assalamu alaikum, and good morning, good afternoon, good evening, depending wherever you are. Mr. Moderator, distinguished panel members, brothers and sisters, first and foremost, I would like to thank the organizer for having me this afternoon, and I apologize that I could not officially take part in the first session, but I echo the speeches that was made by my colleagues and then also the keynote address. The first case of COVID-19 in Malaysia was detected on the 25th of January, but these were all involving 3 foreigners. The first Malaysian was confirmed with COVID-19 on the 4th of February 2020. But the current government took office in March 2020 and has taken all that is required to address the issue. The Prime Minister himself chaired the National Security Council meetings on COVID-19. As of today, he chairs it 3 times a week, but there were times in the past where he actually chaired the meetings almost every day and sometimes on alternate days. The biggest challenge is really to balance, for the government, is to balance between life and livelihood. And as it relates to media and whatever that media is doing, the greatest challenge is to balance between the selling of fear and the selling of hope. By selling of fear, it is not something that we intend or by intention, but we need to tell people that COVID is real. We have to show the data. We have to show how hospital people are working very hard to the extent that they are very, very tired. There is fatigue among the frontliners. And that involves, to some extent, what people call the selling of fear. But we also have to sell hope. We have to show to the people that there is light at the end of the tunnel. And because of that, whatever that we do when it comes to health and public health, we also have to complement with the economic sector, the business sector, the welfare sector, and so on and so forth. Starting the 12th of January this year, the whole country is under COVID-19 emergency. It is not a military emergency. It is simply COVID-19 emergency. so that the government can actually focus 1000%, if you like, on addressing the issue of COVID-19. And from the 1st to the 14th of June this year, we are under lockdown, phase 1, but this is the third lockdown. We have had 2 lockdowns before, depending on the numbers of people affected by COVID-19. Now we are in the third lockdown, but we have faced it 1st to 14th of June, the first phase, and hopefully after that, going into the second phase and third phase. The phases are really about allowing essential economic activities to operate, because no government in the world, I'm sure my colleagues here will agree, can afford a total lockdown. The first total lockdown, it was a real lockdown. The government actually sent food to the poor and so on. Now we cannot do that all the way. So we allow essential services, small business, food, restaurants to operate, but no dining in. It is all about limited, very restricted movement. No social activities, no wedding, no festivals and whatnot. And even we have a lot of festivals in Malaysia. Most of the festivals are on strict SOP. Very limited people, even in the mosques and the churches. Only very limited people are allowed to mass and on Friday prayers and so on. The numbers are on the rise, unfortunately, but our vaccination program has also picked up pace. As of today, more than 3 million of the 32 million Malaysians has been vaccinated with the first dose, and more than 1 million have received their second dose. We are hoping to realize a minimum of 40% of the population getting all their full doses by 31st of August this year, and hopefully 80% by 31st December this year. We have our strategic communication committee at the cabinet level. I'm one of the members, and this is where the media work becomes their #1 priority. You mentioned, Mr. Moderator, about misinformation. We are wary of the fact that we must take care that we disseminate right information based on facts and based on science. And because of that, when we first started in March, we only allowed 2 ministers to speak, because we divide our work into 2 on health, the Minister of Health and the DG of Health, and on non-health issues, the Minister of Defense. Later on, as we proceed, then we actually invite the Minister of Finance, the Minister of Economic, the Minister of International Trade, and others to come in. So it was a structured, quite disciplined, because we don't want confusion among the public as to too many people speaking and so on. Number 2, we have a TV station, the Radio Television Malaysia, RTM. It has 6 TV stations and 34 radio stations in different language. The 34 radio stations operate in 24 local dialects. They are the official COVID-19 television. They have their own program, their grandstand, every day from Monday to Friday, starting at 8 in the morning into 11, and disseminate all kinds of issues. 2 new packaging of issues that is covered by RTM, and we are also talking to other TV stations and radios and the newspapers to cover in a certain way, is on the economic programs, economic packages, helping the poor and so on. And last, the newest addition to the program under the RTM is mental health support. Mental health is a big issue. People are traumatic. Patients, while they are in the hospital or quarantine centers, and after they have been discharged, their caregivers, their families, even the frontliners, psychologically, we need to give the support. Of course, the support doesn't come from my ministry. What my ministry is doing is only to communicate and to channel the support through various platforms. But during the lockdown, kids don't go to school. So there is another challenge. Yeah? One is, how do you educate people when they are not in school? So because of that, the Ministry of Education have started in a small way an education TV program using one of the existing private TV stations. And of course, the bigger challenge is teaching online using the social media. One of our biggest challenges, of course, connectivity. There are still rural areas, especially in Sabah and Sarawak, where there is no connectivity. We are trying our level best to improve connectivity, but at the same time, it is also about the apps, the gadgets that some poor students may not afford to have, and we are trying our level best. How can we assist in that direction? I'm happy to note that the private TV stations and radios are also doing their bit. I think I must also underline the fact here that no matter what, the government upholds the freedom of the media, and we allow people, we facilitate people to report as they like. But then we have another problem, especially in the social media, fake news, as mentioned by a few speakers before me. A couple of things we are doing. Number one, in March 2020, we formed a quick response team that every day look at some of the things that people share on the social media. Many are nonsense, which we don't have to clarify, but there are some that may look like real and that we need to clarify. And on daily basis, we sometimes come up with 2 or 3 or sometimes 1 clarifications. And from March until today, we have come up with 456 clarifications. I'll give an example. For example, people may viral in social media that a particular hospital is closed down because everyone there is affected. So within, 1 hour or so, we have to clarify that there's no such thing. The hospital is operating and things like that. But if someone were to disseminate an information saying that if you eat green apple, you can escape COVID-19, nobody cares. We are not going to clarify this kind of nonsense. But of late, because of the despair, both in health issues and in economics, we also notice that there is some anger among the public. Trust deficit, anger, frustration. This is something that the media are sharing. Some are truth, some are not truth. But as government, we have to be wary of the fact that these are not, these are sometimes real. Trust deficit, anger, a lot of despair. And we have to address that. But unfortunately, some of the anger and despair is also translated into hate speech. And in Malaysia, I don't like to use the term sedition. Hate speech is something we have to be very careful with, especially when it touches issues pertaining to the royalty, the monarch, race, and religion. I won't go deep into that, but these are things that we have been looking at. Social media is something that the government is not very good at. I don't say that with any apology. I think we all know that not so many governments in the world are very good in managing, in disseminating views on the social media. We try our level best, but we are always hopeful that people on social media will share true stories based on facts and science, do not create misinformation. There was a point just now mentioned by our director of ESCAP, which I agree on the role of the media. To my mind, the role of the media, especially now, is not just about reporting and disseminating and sharing knowledge. We look at the media as a partner in decision-making. We have close contacts with the chief editors. We have meetings with them. When we say we treat them as partners in decision-making, meaning we are hoping that they play, and I know some of them are playing this role already, not just reporting and sharing knowledge, but also to give the government feedback. because they're very close to their audiences. Feedback as to what we have done right and what we have done wrong, whether our communication strategy is proper, and so on. Also to give us inputs and ideas as to how do we move to the next phase in the things that we do. Now, Mr. Moderator, let me end on something that I have to say when it comes to the role of the media. You see, when we say freedom of the media, I hope the media also look at that we should not be biased in disseminating, stories and knowledge and news. I'm referring to a few international big players, international social media platforms, which to my mind sometimes have taken it upon themselves to be slightly, to take a certain position. For example, and I won't mention the name of this medicine. There is a debate among scholars and scientists and researchers on a medicine that can be a possible cure or supplement to the cure of COVID-19. But I have been reading and following this, starting from the article written by Michael Capuzzo. I think many media people know him, a New York Times bestseller author, who has just published an article a few months ago, the drug that cracked COVID. But a few international platforms seems very eager to bring down the video of the story, the articles, and so on and so forth, to the extent that many people don't even hear the debate. I think media should allow the debate to go. And my last point is really about Palestine. I would like to put on record that we condemn the act of the apartheid regime of Israel for not allowing or for not doing enough, or probably doing nothing, in providing vaccination to the Palestinians who are under their charge. So, Mr. Chairman, those are my inputs for the time being. Thank you very much.
Thank you very, very much, Your Excellency. Thank you very much for these insightful words and describing what the government of Malaysia is doing to provide information to its citizens and also to fight misinformation, and some of your insights on a broader media landscape, which actually is very very useful. So indeed, it's this balance, very sensitive balance between lives and livelihoods, as you said, and in that balance, accurate information is important, because that's not easy to balance on the individual level. And it's important to give the right information, again, as you said, on facts and science, and clarity information, giving the right information, and your government's attempts to make sure there's specific channels, they are very commendable, but also fighting misinformation and balancing that with still having a debate and having a real debate on what are this, related to the pandemic. As you also said, internet is also one source of information. However, it still can't be the only one. It's also a question of trust, but it's also, as you rightly said, it's always a question of connectivity and use. And if we want to reach everyone, and we must reach everyone in these times of pandemic, traditional media really plays a key role. So really, thank you very much for these insightful, for your insights, and I'm sure that there will be questions at the end of it, and the end of the whole panel, or when other ministers speak, when hopefully we'll ask you to add some additional flavor to that. So thank you very much, Minister. And also I would like to encourage with that the other participants, to use Q&A section of Zoom to provide your questions, and these questions will be collated and again at the end of the session asked the honorable ministers. So our next speaker is His Excellency Alhaji Mohammed. He is the Minister of Information and Culture of Nigeria. So Alhaji Mohammed has served as Nigeria's Minister of Information and Culture since 2015. He's a lawyer, public relations practitioner, and politician. And Alhaji Mohammed was educated at the University of Ife, Nigeria, which is now Obafemi Awolowo University. University of Dakar, Senegal, and the Centre Audiovisuel de Langue Moderne in Vichy, France. So, as well as the University of Lagos and the Nigerian Law School, where he studied law. His political career has spanned almost 30 years, of which he was 10 years as Nigeria's main opposition spokesman. So, Your Excellency, we'd be very eager to hear from you about Nigerian government's efforts to provide accurate information in these sensitive times of pandemic. Please, floor to you, Your Excellency. I think on mute, Your Excellency.
Yes. Yes. Good morning, good afternoon, and good evening, depending on where we are. Let me please first seize this opportunity to thank the Asia Pacific Institute for Broadcasting Development for creating this platform to underscore and highlight the critical roles played by the broadcasting media in containing and mitigating the spread of the COVID-19 pandemic the world over. Before I delve into my presentation, let me thank the AIBD for the support the Institute has been rendering the voice of Nigeria, especially in the area of capacity building, as well as incorporating Voice of Nigeria into its campaigns, such as the International Day of Access to Information, International Day to End Impunity for Crime Against Journalists, and the World Radio Day. The topic, redefining the role of media in the new norm, could not have been more apt, considering how the media came in handy in providing the platforms to mobilize the global population to pursue a common cause against the coronavirus pandemic. The outbreak of the coronavirus pandemic in Nigeria was a very challenging moment for the government at all levels in the country, considering our level of preparedness and the state of our health infrastructure. Your Excellencies and participants, permit me to give you an update on the COVID-19 pandemic in Nigeria. Based on the epidemiological data, surveillance and case management, Nigeria recorded up to date about 166,534 confirmed cases and about 159,935 discharged cases. And we have an active cases of about 7,585. Sadly, we've also lost about 2,099 people. When you disaggregate the statistics, you will discover that the 10 most affected states include the most populous states such as Lagos, the Federal Capital Territory, Abuja, Kaduna, Rivers, Kano, and Plateau states. From the above data, you will appreciate the fact that Nigeria has had its own share of the COVID-19 pandemic, which has even moved to the level of community transmission across the country. Even though Nigeria has commenced the targeted vaccination of its population against the COVID-19 virus with the elderly, health workers, people with underlying ailments, and other vulnerable groups, we are still emphasizing that the observance of the non-pharmaceutical intervention, such as use of face masks, hand washing with soap or use of hand sanitizer, physical distancing, and avoiding mass gathering remains the only way to keep our population safe until we are able to reach a herd immunity of about 70% of the population with vaccination. At the outbreak of the pandemic in February 2020, the Nigerian government took some decisive steps to contain the spread of the virus. It set up the Presidential Task Force on COVID-19, which has now metamorphosed into the Presidential Steering Committee, of which I am a member. The government imposed a nationwide lockdown, banned interstate and international travels, and banned all kinds of mass gathering, among other measures. The president also signed the executive order on COVID-19 health regulations to ensure the mandatory compliance with the safety protocols put in place by the Presidential Task Force on COVID-19. There are 10 subcommittees under the Presidential Task Force on COVID-19, including the Risk Communication and Community Engagement Subcommittee, which is directly being supervised by my office. Part of the activities of the Risk Communication and Community Engagement Subcommittee is to ensure public sensitization and community mobilization against COVID-19. Public sensitization is the key to encouraging the public to observe the non-pharmaceutical intervention in order to protect themselves and their loved ones. As such, the media organs remain the most potent platforms to appeal to the hearts and minds of Nigerians on the need to observe the safety protocols and remain safe. Considering our cultural peculiarities and communal setting, getting people to avoid mass gathering or handshake or encouraging them to use the face mask while outside of their homes was and still remains a huge challenge. Faced with such a Herculean task, we had to rejig the entire media structure and secure their buy-in in order to leverage on the platforms for the mass mobilization against COVID-19. I had to mobilize the entire information organs in the country, those from the public platforms such as the Nigerian Television Authority, the Federal Radio Corporation of Nigeria, the News Agency of Nigeria, the Voice of Nigeria, as well as the private media outlets. For instance, we met with the Broadcasting Organization of Nigeria and the Newspapers Proprietors Association of Nigeria in order to sign on their platforms for the national campaign against COVID-19. Because of the economic downturn due to COVID-19, which affected the revenue stream of the broadcast channels, we had to give them some kind of debt relief and a 2-month moratorium on payment of their license fees in order to encourage them to provide sufficient airtime for the public mobilization. In addition, the National Broadcasting Commission amended the Broadcasting Code to mandate broadcast stations to donate airtime for public sensitization campaigns in times of emergency, especially the COVID-19 pandemic. The National Broadcasting Commission also mobilized over 80 community radio stations across the country for the public sensitization campaign. The approach to response was multifaceted, involving media intervention, leveraging social media, print media, outdoor publicity, production of relevant information, education, and communication materials, which were translated into various languages for broadcast through the national, regional, state, and community media outlets. There was a daily press briefing by the Presidential Task Force on COVID-19, which was covered live by the broadcast media to provide daily situational reports on the national response to the pandemic to Nigerians. We also utilized popular live discussion programs on radio and television for targeted appearances on their audience participatory programs. The Federal Ministry of Information and Culture produced over 50 different television and radio messages in English and other major languages, which were broadcast regularly on about 11 television channels and 45 radio stations across the country. Special contents were deliberately produced with influential persons such as traditional rulers, religious leaders, respected health professionals, and labor leaders, among others, in order to appeal to specific demographics on the need to observe the COVID-19 safety protocols. The public media, that is the Nigerian Television Authority, the Federal Radio Corporation of Nigeria, News Agency of Nigeria, Voice of Nigeria, devote their entire news and programs to the public sensitization against COVID-19. Side by side with the public sensitization against COVID-19 was also the fight against what we termed as infodemic, the deluge of fake news and misinformation on the pandemic, promoting alternative cure and forced protection against the virus. Because of the size of the population in states with endemic cases, we are to embark on targeted approach to community mobilization by securing airtime on more radio stations in those states, and also creating a platform audience participation through live discussion programs to respond to people's concern on the virus. You will agree with me that most, if not all, the broadcast stations in Nigeria have strong presence on the internet, and this also provided another opportunity for intervention through the social media. The fight against misinformation and fake news during the pandemic was waged on two fronts: traditional media and the social media, where we fact-checked information and countered false narratives. With the rollout of the vaccination program in Nigeria, the broadcast media remains one of the critical platforms we are leveraging upon for risk communication and demand generation on the COVID-19 vaccines using different programs for interventions. We're also utilizing the broadcast media to address the challenge of vaccine hesitancy and complacency to ensure we achieve herd immunity in the country. By and large, the role of the media has been redefined beyond the traditional roles of dissemination of news and programs to the deliberate curation of compelling content to create awareness of COVID-19 and the safety protocols, as well as mass mobilization for vaccination. We have to understand that part of the reasons there's complacency to COVID-19 vaccination in Nigeria is a low perception of risk among some of the population, especially in Nigeria, where we did not witness mass deaths arising from COVID-19. However, with the daily discovery of new variants of the virus, we cannot afford to let our guards down. The media has to sustain the advocacy and sensitization campaign and continue to remind its audience that COVID-19 is real and very much around, and that the only way to be protected is the observance of the non-pharmaceutical intervention and vaccination. I thank you very much for your attention.
Thank you very, very much, Your Excellency. Thank you again for the very insightful words and explaining how Nigeria took measures and also giving us an outline of what is really important, and from the leadership at the level, the whole way to the president, to structure the process and to make sure that everything is coordinated, to mobilization of all media sources in terms of social media and traditional media in languages and national, state and community, also to bringing authoritative voices to explain to there is something unmuted, sorry. So, and then also, Your Excellency, also thank you very much for reminding us that it's not time to let the guard down, and we still need to continue working on that and providing accurate information and ensure that we save lives and save livelihoods, as previous speaker has said. So our next panelist will be His Excellency Dr. Prasith, Deputy Minister of Information from Cambodia. So His Excellency Dr. Prasith is the Secretary of State in the Ministry of Information of the Kingdom of Cambodia from 2018 and to the present day. He started working for the Royal Government of Cambodia in 1995, and in 2004 he became an advisor to Samdech Chesim, President of the Senate of Cambodia. In 2011, Prime Minister Hun Sen appointed him to serve as an advisor to the Royal Government of Cambodia. And he also, in 2018, got a doctoral degree in law from the University of Indonesia. So, Your Excellency, Dr. Prasith, so we would welcome your insights of how the government of Cambodia is using media to provide accurate information in these critical times. Please, Dr. Prasith. I think you're on mute, Dr. Prasith.
Thank you very much, moderator, about ministerial session talk. First, I would like to thank you very much for Mr. Philo, and I appreciate thanks and respect to the Excellency Dr. Khieu, Minister of Information of Kingdom of Cambodia, and Mr. Armida, the keynote address. And thank you once again for all the panelists join these sessions. Good morning, good afternoon, Your Excellencies, Minister, Vice Ministers, Directors, distinguished panelists, all guests and delegates. Ladies and gentlemen, warmly greeting from the Kingdom of Cambodia. I would like to express my highest appreciation thanks to Asia Pacific Institute for Broadcasting Development, AIBD, for hosting such important leader web summit and for inviting me to deliver my humble remark at the ministerial talk on media's role in dissemination of information on the pandemic, which focus on the sharing experiences among member states and how to tackle COVID-19 pandemic. Taking of opportunities, I would like to brief you on the recent development of COVID-19 in Cambodia so far. There are more than 26,000 of Cambodian people have been affected by COVID-19 in Syria or community infection and imported cases from foreign countries until 1st June 2021. There are 23,389 people have been recovered. 7,321 people under medical treatment and causes 220 patient death. The Royal Government of the Kingdom of Cambodia would like to extend its profound thanks to the government of the People's Republic of China and the World Health Organization for the donation of the COVID-19 vaccines to the Kingdom of Cambodia. I am also proud to inform the meeting that Cambodia have received the World in appreciation on its containment measure against COVID-19 pandemic, and its kindness is allowing U.S. cruise ship Western Dam with 1,455 passengers to board in Cambodia seaport Sihanoukville with the warmness hospitality extended by some Dato Prime Minister Hun Sen himself. Ladies and gentlemen, at the time of the widespread of the COVID-19 pandemic in Cambodia, the Ministry of Information, supported by the Media Institute, namely the General Department of National Television of Kingdom of Cambodia, TVK, and the General Department of National Radio of Cambodia, RNK, and Agence Campuchia Press, AKP, Ministry App Department, as well as Information Department at provincial level, are working very hard to disseminate factual news to the public in order to inform them about the real situation on COVID-19 in the countries, to educate them about how to safety in vaccination, to explain them about the government necessary measure in city lockdown and pure news, and to encourage them in implementing the health advisory in the three do and three don't, plus stay home if not necessary to go out, in order to stop the widespread of the coronavirus disease among Cambodian people. The explanation on the campaign not to drink alcohol during city lockdown was also well disseminated by the state and private media throughout the country. During the spreading of the COVID-19, the fake news is also emerged as the major challenges against the livelihood of the Cambodian people. The fake news are disseminated in many forms throughout the media platform, especially on the social media, online content, in countering fake news. The Ministry of Information conducted several measures in order to secure safety and stability for our nation. At the nation level, the Ministry of Information conducted a series of national and international seminars, workshops, and training courses for media officials and journalists from state and private media hubs, so as to promote the knowledge how to report the factual news to publics and join hands together to fight fake news throughout the country. Meanwhile, the General Department of Information and Broadcasting under the Ministry of Information has also set up surveillance teams to trace harmful fake news content disseminated by social media, website, blog, print media, electronic media in order to notify the public about those fake news and encourage them to follow only official and reliable information sources. At regional level, the Ministry of Information of Kingdom of Cambodia have full supported and appreciated the joint statement of the Asian minister responsible for information to maximize the negative effect of coronavirus disease 2019 COVID-19, which was adopted on 25th August 2020, and the Armida framework joint declaration to maximize and harmful effect of fake news, which was adopted in 2018. In the partnership with the Asia Pacific Institute for Broadcasting Development, the Ministry of Information of the Cambodia have introduced the regional declaration, namely Angkor Wat Anti-Fake News Initiative launched at the Asia Media Summit 2019 held in Siem Reap province and was officially signed by Excellency Dr. Khieu, Minister of Information and AIBD President during AIBD General Conference in Bhutan in August the year 2019. The initiative involved conducting a year-long research project on the impacts of disinformation on its members countries, and AIBD to undertake various activities as a seminar, workshop, conferences, and another relevant activity within member to counter fake news. AIBD, in cooperation with the UNESCO and Malaysia University Berjaya, has completed the report of the one-year research, namely fake news and its impact on public service broadcasting practice, need and way forward. I hope AIBD have already shared this achievement to all member states. Not limited by the above effort, the Cambodian government, under the brilliant guideline of the Dato Prime Minister Hun Sen, has made many other preventive measures to counter COVID-19 pandemic. In fact, the Kingdom of Cambodia have recently focused on creating sustainable content industry to make an activity with the both vertical and horizontal in TV broadcasting and distribution of media contents. Discussion on the complication or activity for competition in media industry and media policy making was invented. Moreover, the royal government aspires to set forward-looking perspective on the regulation on the digital TV, radio, and industry to support the government policies in promotion of public awareness, which also include the COVID-19 pandemic. Last but not least, may I take this opportunity to extend my best wish to your Excellency Minister, panelists, and all participants, the best of health, and stay safe from the COVID-19. Thank you for kind attention. Thank you.
Thank you very much, Your Excellency. Thank you very much, Dr. Prasith. And indeed, thank you very much for highlighting the extensive efforts that the government of Cambodia has undertaken in this pandemic to ensure that people have accurate information, and to highlighting importance of clear and simple messages, importance of providing factual news and fighting fake news. And this is now becoming the common thread among all the speakers. So clearly that's an important aspect. And also highlighting the activities that AIBD is doing regionally, and clearly that is being found useful. And thank you very much for this nice wishes. It's clearly we still need them. We still need to keep ourselves safe. So thank you very much, Dr. Prasith. And with that, I would like to turn to another minister, to His Excellency Dr. Hasan Mahmud, Minister of Information and Broadcasting of Bangladesh. So Dr. Hasan is the Minister of Information and Broadcasting of Bangladesh. As I have just said, he has been involved in politics since his student days. Dr. Hasan Mahmud is also a well-known environmentalist, both at home and abroad, and he was awarded with a Certificate of Honorable Mention by Green Cross International, which is an environmentalist organization, and he was awarded, given that award for his strong role of global climate change. He is also the President of Parliamentary Standing Committee of Environment, Forest. He was also the President of Parliamentary Standing Committee of Environment, Forest and Climate Change of National Parliament, and where he worked very successfully to tackle the country's environmental and climate threatening issues. So indeed, it's very appropriate for Dr. Hasan Mahmud to be dealing with also COVID-19 in this crisis, and he clearly has a lot of experience in fighting another very important crisis that we also face, which is climate change. So Dr. Hasan Mahmud, Your Excellency, the floor is yours to give us an outline what the government of Bangladesh is doing to provide accurate information in these difficult times. Please.
Thank you very much, Mr. Tomas. His Excellency Dato Saifuddin Abdullah, Honorable Minister of Communication and Multimedia of Malaysia, the host country of AIBD, and Honorable Ministers who are connected in this conference, and all the people who are connected to this conference. My best wishes to you all. Indeed, I want to register my thanks to AIBD to organize this talk, this conference, in this difficult situation. In this situation, the role of media to fight with COVID-19 is very important. And as you know, Bangladesh is a very populous country. Bangladesh population density is the highest in the world. Per square kilometer population density is 1,200. And the total population of Bangladesh is more than 170 million. And the capital, Dhaka, itself has 20 million population, and Dhaka region, about 30 million population. And capital Dhaka is one of the densely populated city in the world. In a country where the population density is so high, and huge crores of people, millions of people are dependent on daily income. In that country, it is a very difficult situation during the coronavirus, during COVID-19 scenario. But still, due to the able leadership of our Prime Minister Sheikh Hasina, daughter of the father of the nation, Bangabandhu Sheikh Mujibur Rahman, she is able to control the COVID-19 in Bangladesh. Also, in this country, she has been able to provide to the people, to huge number of people who are dependent on daily work. She has been able to provide them work and food and etc. At the beginning of COVID-19 scenario, many people at home and abroad said that in Bangladesh will face a grave situation. But fortunately, due to the able leadership of Prime Minister Sheikh Hasina and by the grace of Almighty Allah, that situation has not happened in Bangladesh. Bangladesh, I can say today, the scenario is much better than many other countries. And in Bangladesh, the scenario is better than India. And you'll be happy to know that during COVID-19 scenario, in all countries of the world, the GDP, size of GDP has been shrinked. And GDP growth rate is minus almost in majority of the countries, almost all countries. According to different findings, a report of credible organizations and international media, only 20 countries had positive GDP growth rate during last year, 2020. And among this country, Bangladesh is one. And in the list, Bangladesh position is third. And above Bangladesh, only two countries. One is South Sudan and another is Guyana. And we had positive GDP growth rate in 2020, 5.6 during coronavirus scenario. And in Bangladesh, you know that population, as I said, population density is so huge and people are dependent on daily income. At the beginning, many people said at home and in abroad that people will starve. But in Bangladesh, this has not happened. And you'll be happy to know, because I want to share this with you, you'll be happy to know per capita income in Bangladesh in the last year has been increased by $200, about $200. In this situation, it has been increased than the last year by $200. So in this difficult situation, our government, under the leadership of Prime Minister Sheikh Hasina, was able to control COVID situation, at the same time was able to put forward our economy, and economic development is in progress in Bangladesh. And in doing so, the role of media, especially to control, to aware, and to aware the people the best practice against COVID-19, the role of media was very prominent, was very vital. And I would thank all the mainstream media for their role in this scenario. And I want to tell you, because of the media's role, our journalist community during this scenario has been working without any fear. But because of that, they have paid a high cost also, paid high price also. Till today, more than 500 journalists have been affected by COVID-19, and more than 50 journalists have died because of coronavirus. Many prominent journalists also have died because of coronavirus. Despite this, the mainstream journalist community is still working without fear to cover the news and also to fight coronavirus. And the role of social media is very vital. At the beginning, you know that social media is a media that is not edited. It's not an edited platform. Anybody can say anything. And at the beginning, Many rumor, some people in each country, it happens, I think. Many people try to do some rumor and wrong information through the social media. And fortunately, we could control that. Rather, we could use the social media to award the people the best practice against the COVID-19. Even myself, I got some information from the social media, how to do the best practice, how to do the daily life, how to change our daily life in the social media. So social media also had a very vital role and has very vital role in this COVID-19 scenario. So in Bangladesh, this is the situation. Globally and in our region, also the same scenario, I believe. But the difficult task today before us is that coronavirus through mutation, different variety of coronavirus is evolving. We have heard about Vietnam variant a few days ago. You know about the Indian variant, which are more powerful than the previous coronavirus. So the role of media and coordination among our countries to aware the government and also to aware the people in this situation is very important. So this kind of talk, I think, is very important, and also talk to find out how more effectively the media, mainstream media, and also the social media we could use for the betterment of the people and to fight against coronavirus. Being an environmentalist, I would say that we humans very often think we are the master of the world, and this planet world belongs to us. But that is not true. This planet Earth belongs to everyone, every creature of God. But very often we humans forget this. And that's why we want to manipulate all the resources of the planet for us. So how coronavirus has affected the human, that is still a controversial issue. But many says it has come from animal or so. So eating everything, the practice of eating everything, we should not do this practice, and we should remove from our mind that we are the master of the planet and everything belongs to us. That we should remove from our mind. So this is not the last virus that has affected the human being in this planet. In future, also many other pandemic will come. So today, and I don't know, and nobody can say how long this coronavirus will remain in this planet, because through mutation, it is changing every day. So, and now some vaccine have been, many vaccines have been invented, but in some variety, it has, doctor says, I'm not a doctor, but doctors are saying that some variety even bypass the body's immune system. So if that is the case, what to do? And how to improve the capacity of the vaccine? That is a question. That is a task before us. So in future, I don't know how long it will sustain. It will continue to affect the human being in this planet Earth, the coronavirus, COVID-19. But we have to keep in mind that it might continue. So how to use the media for better practice, and how to invent, doctors inventing different practices, how to disseminate this information in our country and in our countries, that we have to find. and also sharing the knowledge with each other. That is also very important. So I would not elaborate my speech. Finally, I would say that we must have more coordination and cooperation, and we must find how to use more effectively our media, and also how to use for the betterment of the people, for the betterment of the community, the social media. And we have to find the way how social media, we can forbid the social media not to, so that social media does not lead the people wrongly, or wrong or fake messages, newses are not spread through the social media. That we have to find also. I think in this respect, the service providers also, the social media service providers also have some responsibility. From this conference, we can take a resolution that we should communicate with the social media service providers, so that social media, by using social media, people cannot mislead the people and cannot spread the rumor among the society. And for that, the social media service provider takes some step. We can take a resolution in this conference and we can communicate with them. Finally, with the deep appreciation to AIBD for connecting the Asia Pacific nations and different people from all over the world, and organizations different organizations from all over the world. And thanking you for giving me the chance to share my ideas with you. I want to thank you. Thanks to you all.
So thank you very, very much, Honorable Minister. So Your Excellency, Dr. Hasan Mahmud, for giving us an outline of how Bangladesh is doing in this pandemic, and also, showing that in terms of livelihoods, that the life and economy can still be going on, and and the economy can be increasing, and that's a great achievement. And again, reiterating the importance of leadership, as we heard before, and importance of controlling fake news, both especially in social media, which is very difficult to ensure that sources are trusted. But I really like a reminder, Your Excellency, about this. Not just for this one. We'll not be resolving issues and trying to find solutions for this pandemic. We cannot control everything as humans. So we need to find these longer term solutions for the things to come, and not to be kidding or hiding from ourselves that this is just one-time thing. So with that, I'll move to actually a video presentation, and we'll have a video presentation of His Excellency Jose Ruperto Martin Andanar. He is Information Minister of Philippines, and of course, in these difficult and very busy times, so we're still grateful to the Minister for sending this video remarks to our panel. And so His Excellency has completed his Bachelor of Social and Political Studies in Film and Media Studies at the Federation University in Australia, and then was a Senior Executive Fellow in Harvard University. And also this was followed by his different stints at Georgetown University and others. His Excellency has also been a TV news anchor, radio commentator, podcaster, video and audio blogger, and voiceover artist. And he is now risen to his present position as the head of Presidential Communications Operations Office. His Excellency also served and recently been commissioned in the Reserve Force, Armed Forces of Philippines, with the rank of Commander. So we'll hear from His Excellency how Philippines are doing and ensuring trusted source information in these crucial times. Please play the video. Thank you.
Your Excellencies, ladies and gentlemen, good day. Today, I will be talking about the Philippines' perspective on redefining the role of media in the new norm. The media plays a pivotal role in raising people's knowledge and awareness of multifaceted issues both domestically and internationally. It further keeps people abreast of issues that may affect them or affect others. It has become a part of our life and is integral to our democracy, which is why we have fought to protect it and its freedoms over the years for everyone's welfare and interest. Traditionally, media was a one-way channel where a single message is delivered to an audience who had no participation in the process of creating the message and had limited means to provide feedback. The society in this setup had a meager participation and role in the process of information exchanges. The responsibility and obligation, therefore, to disseminate and propagate needed information were given to credible news media outlets for everyone's consumption. Here, the government also plays a key role in this process as a source of news, especially on social, economic, and political affairs. Although social movement and empowerment had truly impacted the role of the society in this communication process, it is technology and the advent of social media that revolutionized how this process came to be as we know it now. In the Philippines, there are at least 89 million social media users based on the data reported by We Are Social and Hootsuite in January 2021, who most may be digital journalists, news makers and providers, and information sources, among others. It has impacted how information is being produced, rendered, generated, and delivered, and it has diminished to some degree the role of traditional media in this process. However, the impacts created by the COVID-19 pandemic in its early stages, the role of both traditional and digital media have been severely minimized as traditional operations had been halted. The employment, therefore, of a multifaceted approach was deemed necessary and vital for the continuous flow of life-saving information. As a government withstood the test of the pandemic in its early stage and given our mandate in engaging and involving the citizenry in the mass media, we in the Presidential Communications Operations Office have been proactively employing efficient strategies in generating ideas, information, solutions, and communications responses and materials, which continue to enable us to address societal concerns, difficulties on matters important to our collective development. We have imposed upon ourselves the duty and obligation to redefine the role of media, may it be from the government or private, to become more innovative, inclusive, sustainable, proactive, and most especially collaborative with the different sectors of our society. As we respond to the COVID-19 pandemic, our programs on the promotion and information dissemination on the efforts, policies, and actions of the Duterte administration are being initiated, highlighted, and intensified. Our Laging Handa information and communications campaign continues to deliver life-saving and factual information and to disseminate particulars of the relevant programs of the Duterte administration in our response to the virus and to ensure everyone's safety and welfare. Under the said campaign, we have undertaken multiple and diverse programs to cater to different target audiences of our community, not only for the better comprehension and appreciation of our audiences, but also for their better retention of all information being disseminated on COVID-19. We have maximized the use of TV and radio broadcasting, print and digital media, and on-ground communication to arm the public in this regard. The Laging Handa public briefing continues to embrace a whole-of-nation approach wherein guest resource persons from key agencies directly and virtually engage the public across the country about the COVID-19 pandemic. Our network briefing news is meant to bridge local government units and the local media with the national government through live virtual interviews. Our COVID-19 PH radio provides round-the-clock information about the COVID-19 and the various programs that tackle the developments in the country's fight against the pandemic. Our COVID-19 website, complemented by our official social media pages and accounts, serve as a one-stop portal of all official information on COVID-19 in the Philippines from various government agencies. Our Laging Handa Docu provides experiential and informational short documentaries highlighting the lives of healthcare workers and other frontliners, as well as the efforts of the government in combating COVID-19. Another is our virtual presser, where journalists based abroad can directly ask top government officials about the country's COVID-19 response. It further promotes nationwide initiatives to address concerns and provide public updates on the COVID-19. As we continue rolling out our national vaccination program to ensure the minimization of the impacts of the COVID-19 pandemic to our communities, our Vax Planer series intends to provide factual information on the different actions of the government regarding community vaccinations, different COVID-19 vaccines, and COVID-19 in general. These are among the award-winning initiatives of the PCOO, not only in responding to the impacts of COVID-19 pandemic, which have been recognized by renowned business and public relations award-giving bodies such as the Stevie Awards. These programs are also meant to showcase the efforts, policies, and programs of the Duterte administration for our collective progress and development for the benefit of all Filipinos. This global health crisis continues to serve as a catalyst to redefine the role of media in this new normal. It has allowed us to see the gaps that needed to be filled, the difficulties we had to overcome, and the problems we continuously need to fix and anticipate. With these, let us continue making information and its deliverance as a public good, innovative, inclusive, sustainable, collaborative, and proactive in responding to communal difficulties and promoting community development and nation building. As I conclude my talk, I would like to enjoin everyone, especially those from government, private, and independent media outlets, to collaborate, innovate, and stand with each other. It is only through our unity and togetherness that we can overcome such challenges, especially during the COVID-19 pandemic, and develop and progress collectively. Let us continue to follow health protocols in COVID-19 pandemic to be safe from the virus and prevent its further spread. Thank you very much, and good day, everyone.
So really appreciate this message from His Excellency, who also highlighted, and some other previous speakers before him, the challenges dealing with much more complex media landscape in which social media plays a increasingly bigger role. But also, again, government actions and taking coordinated, but also very multifaceted campaign in addressing the issues and delivering information to people. And really important, his call for us all to collaborate and innovate, because as we all see, is a lot of what we're facing is new, but also we need in this very complex world to work together. So with this, we conclude the speeches, and we have time probably for one question, and we've been collecting questions as we during the session. And I think, some of those were already covered, especially about disinformation and fighting fake news. I think ministers have already addressed to some extent. But also one question that, in my mind, still probably could warrant some additional words from ministers is the question that comes from Asia Rahman Khan Rodi, Deputy Director of External Publicity Wing of Ministry of Information and Broadcasting of Government of Pakistan, is about, so can the media be used for the economic uplift in the wake of COVID-19 and in new normal? And if yes, then how? So how can exactly media be used to promote further economic development, at least not to stop economic activities, and make sure that people can continue the economic lives? And we'll start in the same, and in the sake of time, I will ask their excellencies to be brief, maybe 1 minute or a little bit more for the answer. And we'll start in the same order as we had a discussion before. So if we can ask His Excellency Dato Saifuddin Abdullah from Malaysia to provide his views on that, whether the economic uplift can be impacted and supported by media. Please, Your Excellency.
Yeah, thank you. It's a very good question. But let me start by saying when government use the media to impart information on the economic activities, particularly those propagated, those who are planned by the government, we must ensure that this is not propaganda. It is simply dissemination of knowledge. I think it is important for the media to help out because I'll give an example. When a particular minister of finance or economic minister in any government were to give a press statement or TV interview on the economic plannings and projects, especially during the pandemic, people in the rural area, men on the street, may not understand economic language. It is very important for media platforms, depending on their audience, to translate those economic languages into graphics, into simple terms that men on the street can understand. Otherwise, all those good things that whether it is from the government or from the private sector may get lost, in all of the noises. And I think this is where media can play a very important role, not just to disseminate, but to help explain in a language that most people can understand, depending on the different levels of understanding and different population groups and different audiences of the various platforms. Thank you.
Yes, thank you very much, Your Excellency. Indeed, it's very important to make information accessible, both in its reach and also in its content. So, so now I would like to ask His Excellency Dr. Hasan Mahmud of Bangladesh to also provide his views from Bangladesh perspective. How can media be used to encourage economic uplift? And you already explained us how rather well, comparatively well, Bangladesh was doing during the pandemic. So, do we have? Okay. Sorry, I'm kind of apologies. The minister had to go, so maybe I will ask His Excellency Dr. Sok Prasith of Cambodia to give his views about how, from Cambodia's perspective, in terms of whether media can play a positive role in economic uplift. Thank you.
Thank you very much for Mr. Tomas, moderator. It's really very interesting about media and dissemination of information nowadays that in Cambodian side that we would like to express. And then in fact it's not just only Cambodia right now, it's the global that we got a situation the same, that the problem that about the disinformation and then fake news, and then also that we must be that standing together to fighting about to the fake news together, and then that to try to destroy the anti-fake news, to build up about the capacity building, and then sharing some experiences to among us any country in the global. So I just have any short comment to join that. Please let the AIBD try to facilitate and then promote our partner to join in sharing some knowledge to among us the country in the global or in the partners. Thank you very much. Just only left this message. Thank you very much for Mr. Tomas for moderator. Thank you.
So thank you very, very much, Your Excellency, for this for these insightful words. And then I think now, with this we conclude this discussion. However, I would like really ministers to stay with us for a little bit, because first of all we'll have a photo opportunity in a minute, and also we will have a launch of a very exciting initiative in a couple of minutes. So, and also, but before the photo opportunity, I would like to remind that we have rapporteurs observing the session, and Dr. Ismail Shah from ITU and Rabi KC from Nepal, who will be presenting the report in the end of the day. So thank you very much for your hard work. And so now is the time for the group picture. So if everyone could be in the frame, and our staff will take the picture, please. So.
Right, so the count of 3, 2, 1.
So do you understand? Do you understand that we have a picture taken? So thank you very much. Thank you for that. And then with that, we move to another major highlight for today. And I'm happy to be part of this the launch of the new initiative undertaken by the Asia Pacific Institute for Broadcasting Development, AIBD. And it's my great pleasure to invite the Honorable Minister of Communications and Multimedia of Malaysia, His Excellency Dato Saifuddin Abdullah, to launch this initiative. Please, Your Excellency.
Yes, thank you. Distinguished guests, brothers and sisters. I am most pleased to announce our ongoing efforts to develop a content exchange platform to be aptly called TV AIBD. Though this initiative is still in its infancy stage, every concept originates from humble beginnings. We are in an era confronted by various physical constraints and restrictions, and we believe that the time is right for the Institute to have its own broadcast platform, with the prime objectives of increasing the visibility of the Institute, and also, equally as important, to serve its members by positioning this platform, number one, as a channel to give exposure for the Institute's ministerial and high-level dialogues and forums. Number two, as a marketplace to introduce informational and entertainment content of our members. Three, as a gateway for the various broadcast players to showcase their products to our members. Four, as a marketing outlet for the various economic sectors of our respective countries, especially tourism and healthcare. Five, as a platform to highlight the UN initiatives toward the SDG Agenda 2030, and six, content sharing portal for Asia and the Pacific. I'm confident with TV AIBD's humble start via the social media platforms, including YouTube, and a captive audience, this channel will evolve itself into a fully fledged regional broadcast platform. There has been already much interest generated when we announced this endeavor. AIBD is always open to strategic discussions for the mutual benefits of all parties, especially its members. The AIBD TV digital platform reaches out to a global audience via YouTube. It will also be on our website. Programs that are featured and of interest to members will be shared via links, etc. The platform will feature exclusive interviews with world leaders and newsmakers on topics ranging from policy, culture, and socio-economic issues. Broadcasters are free to use these interviews for their respective channels. So, Mr. Moderator, distinguished guests, brothers and sisters, I hereby officially declare the launch of TV AIBD. Congratulations. May I share? Yes. Oops. Can we see it?
Yes, I think so. If you could bring it closer to the camera.
Yes.
Mm.
Okay.
Yeah.
Yes. Okay. Oops.
Just a bit more central, but it's fine.
I know the lights. It's about the lights.
It's fine, fine.
Yeah, I'll be a little traditional now.
Very nice.
Yeah, it's okay. It's actually a very nice logo here. Yeah. All right. Okay. All right.
Thank you very much.
Thank you. Congratulations again.
So really, really exciting initiative, and thank you, Your Excellency, for launching it. And it's only appropriate that Malaysia is announcing this initiative on behalf of AIBD, because since 1979, when the institute was founded by UNDP and ITU and UNESCO, together with the consensus of government of Malaysia, Malaysia has been a host of AIBD, and I think we're all grateful for the government of Malaysia of doing this excellent service to the broader community. And let's now take a photo with the logo of TV AIBD, and so that we all saw our cameras on. And thank you. So the staff, I'll allow the staff to announce the photo time and countdown.
We are waiting for His Excellency Sok.
Mm-hmm.
Comes back. Oh, okay.
So Nabil, I think you can start the countdown.
Yes.
Dr. Khieu is already in frame. Yeah.
Yeah, I think yes, Dr. Sok is in frame now. So,
Excellency Dr. Khieu, His Excellency Dr. Prasith. I'm about to click the picture. So on the count of 3, 2, 1. Thank you very much. Thank you very much.
Thank you very much. Thank you very much. And it's been a really honor to moderate the session this morning, and also to witness and to announce the announcement of the launch of this exciting platform where traditional meets new, you know, so also moving in a social media and the digital world. And with that, I conclude this session and give a word back to Philo. Thank you very much, AIBD, for giving me this opportunity. Philo, the floor is yours.
Thank you so much, Tomas Lamanauskas, all the way from UK. And yes, and you know, it was really exciting to listen to 5 dignitaries speak on what's in place and what the media did, the awareness that media created during the pandemic. And I think there's a lot more work to be done. And I think being Malaysian, I know that there's so many things and initiatives that His Excellency that Saifuddin spoke about. And it's really heartwarming to know that actions are in place and media is doing its bit. Thank you, Excellency, for launching the TV AIBD. Like Thomas said, it's a platform where digital meets the traditional. And now I would like to call upon the newly appointed AIBD GC President by the Government of India, Mr. Mayank Agrawal. He was in office just last week, and Mr. Mayank Agrawal is the Director General of Doordarshan Television. Mr. Mayank Agrawal has over 3 decades of experience in the field of public communication. He's senior officer from the Indian Information Service and he has held several senior positions in All India Radio, Press Information Bureau, Indian Institute of Mass Comm, and also played a vital role in the AIDS control. He is in the National AIDS Control Government of India. And with broadcast journalism as his core work, he has been associated with several news shows and documentaries. So he works widely in the field of AIDS awareness and has been recognized, particularly the Red Ribbon Express project in India in 2007 and 2009 for spreading awareness on HIV/AIDS. And without much ado, I'd like to call upon Mr. Mayank Agrawal to say a few words. Thank you.
Thanks, Philomena. It was a very enlightening opening session. And thanks, His Excellencies, for the remarks you have made. Particularly, His Excellency Dato Saifuddin Abdullah, Minister of Communications and Multimedia, Malaysia, for launching TV AIBD. It is a landmark initiative for which Asia Pacific Institute for Broadcasting Development deserves huge compliments. Congratulations, Philomena, Director of the Institute, and your team, which conceived this idea and made it possible. The objectives behind the new initiative are novel and highly laudable. The new platform will connect the people, provide voice to the communities from Asia Pacific to Latin America and Europe, and feature interviews with the global leaders. TV AIBD will also promote content sharing among member countries, work closely with UN bodies in promoting Agenda 2030. I'm happy to say that it will also feature latest productions using immersive technologies on its platform. In the Corona times, when the world has become too more restrictive place to travel, video sharing is an important tool in empowering lives. We can together make a happier world to live in. Even when there is an air of despair and despondency, a lot of good things are happening around the world which are not in public domain. We can learn from each other's traditions, cultures, the knowledge preserved by the communities, and the new advances in the field of technology and medicine at the same time. We need to share the good practices. The aim is high and the dream is big. The success of the new platform will depend on active participation by the member countries and their respective organizations, the quality of the product, and usefulness of the content. There is the oft repeated quote of Marshall McLuhan. I will like to read it out here. The new electronic independence recreates the world in the image of a global village. And today we are realizing how the digital platforms have transgressed borders and made the world revolve at our fingertips. TV AIBD will hopefully evolve to become bigger and become a global content platform. Thanks all the participants for making this session so insightful, so wonderful, and I am sure the deliberations over the next 2 days till tomorrow, they will bring a lot of new insights. Thank you very much.
Thank you so much, Mr. Mayank Agrawal, newly appointed President of the AIBD GC. We're honored to have you today. And indeed, that was what you said was absolutely right, that TV AIBD will be, the main reason why we started was to reach out to all members and to create a content sharing platform. So we're hoping that every member who's present here today, AIBD has more than 100 members, media organizations, service providers, and we hope that you will share with us your content and also peruse what we are putting into our platform. And one day, definitely, this is going to be a real fantastic outlet or television channel, perhaps in the future. Thank you once again, Mr. Mayank Agrawal. And now, perhaps, Nabil, do we want to take on another photograph? Or should we move to the next session? So we shall now move on to the next session. But before that, let's see this video. Okay, so this is session 1, the official session. Okay, we have something else happening, right? Thank you so much. And there you go. You are with us in the Leaders, first ever Leaders Web Summit. And we're talking about the role of media in the new norm. And this is something really exciting because we have lots of exciting things planned out for you. Tomorrow is another day. But first, let me move on to what we have right now, devising safety guidelines for media practitioners during the pandemic. And we have many eminent speakers from all across Asia Pacific and also Europe. Let me introduce now Ms. Vidyarana. She is the moderator for this session. Ms. Vidyarana is Communications Manager from the Asian Disaster Preparedness Center, ADPC Bangkok, Thailand. And she comes with more than 10 years of experience in journalism and development communications. So she works with the ADPC in Bangkok with a focus on engaging with media in reporting on disaster risk management and climate resilience in Asia and the Pacific. Her areas of expertise include nonprofit strategic communications, brand development, and campaign designing. So without much ado, Vidyarana, the floor is yours. Thank you, Vidya.
Thank you very much for the introduction. And it's a great honor for me to moderate this session. Good afternoon, everyone from Bangkok. I would just like to share a little bit of background of this session. So as we all know that COVID-19 surfaced in December 2019, but the third week of January 2020, it had killed 3 people. In less than 3 months, it shut down the world while WHO declared the outbreak a pandemic in March 2020. And in 6 months, the death toll reached 1 million people worldwide by the end of September of 2020. Now, media organizations were also caught off guard as the crisis unfolded. Like the rest of the world, it was a nightmare, and it is a nightmare for media industry too. But it was also an unprecedented news story to be covered with responsibility in an extremely challenging environment. Being the people's ears and eyes, media has been playing a crucial role in providing life-saving information to the world. However, majority of the media practitioners work in extremely difficult situations while reporting on disasters and health crises. Having proper standard operating procedures in place while reporting on or during pandemics like COVID-19 are very important to safeguard the well-being of media. And there is an urgent need for devising safety guidelines for media practitioners during pandemic. And this is the topic of our today's session. And to discuss this important issue, we have 4 panelists with us. Mr. David Haw is joining us from Special Broadcasting Services, SBC, Australia. David is Director, Audio and Language Content at SBS. Mr. Sonthil Rajan is with us from Doordarshan, India. Sonthil is Additional Director General News at Doordarshan, India.
Okay.
Mr. Vincent Lai has joined us from Phoenix Satellite Television, Hong Kong, China. Vincent Lai is Executive Producer, Production Department News, Broadcast Technology and Production Center at Phoenix Satellite Television. And we are also joined by Mr. Leon Williams, Director Policy and Program, Free Press Unlimited, or FPU, Netherlands. Welcome to all of you. Let me start with this session with David Ha from SBS. But before I jump into the presentation, let me introduce him a little more. So David has 20 years experience in the media industry. He has held a number of senior executive roles at the Australian Broadcasting Corporation and has been responsible for diverse portfolios across content, marketing, commercial, radio, and digital. Prior to coming to SBS, he led the ABC's international services, including Radio Australia, ABC Australia TV, and digital services that connect audiences around the world with Australian stories. He will be talking about COVID-19 response from SBS. Mike is yours, David.
We are hearing some sound. Sorry.
Yes, I'm not entirely sure where that's come from, but I'm happy to make a start.
I have muted some of the speakers, so you can proceed, Ms. Vidya.
All right, thank you so much for that welcome. It is an absolute pleasure for me to be a part of this presentation today. And congratulations to the AIBD for just launching TV AIBD as well. That's fantastic news, and I'm really looking forward to how that is going to roll out. And I'm also really looking forward, congratulations to Philomena and the team. I am just sharing with you the experiences of COVID from the Special Broadcasting Services point of view from Australia. Before I do that, as well as thank you and acknowledgements to everybody, I do want to acknowledge that I am on Indigenous land here in Australia, in Sydney, and in particular, it is land of the Gadigal people of the Eora Nation, who are the traditional owners of this land. Again, my name is David Hua, and I'm just going to take you through SBS's journey first up. And the story of SBS starts in 1975. We actually output content in over 60 languages. We have radio output. We've got television output on a number of different channels. And we also have on-demand podcasting and website content, of course. You will know of the ABC, which is the Australian Broadcasting Corporation. But with SBS, we have got a remit to provide audiences in Australia with multilingual and multicultural content to keep them well. SBS actually started in 1975, like I mentioned. It started with radio, and our core purpose is actually to keep, at the time, was in relation to the rollout of a healthcare system in Australia. So COVID actually lands really quite interestingly in our portfolio of activities, because it goes right back to our remit in terms of keeping the Australian community safe. Like I mentioned, we output content in over 60 languages. And I was really pleased this year in February to include Auslan, which is Australian Sign Language, as being one of the languages or one of the services that we provided around the vaccine rollout in Australia. So we produce an enormous amount of content across different platforms, and that's all audience facing, of course. What we're here to talk about is how SBS as an organisation, as a multi-media organisation with many touch points into the community, actually was able to continue to do our jobs when COVID hit around February, March last year, and how we've actually been managing since then. So I'll just stop sharing my screen and just talk to you about those elements. So Firstly, it was a situation whereby as soon as we had the lockdown announced in Australia, everybody who could needed to work from home. That included our broadcasters, and connectivity was one of the main issues. We actually had people who weren't connected to the internet particularly well and didn't have the equipment to be able to publish and to broadcast. Very, very quickly, we had to endeavour to arm people, and I'm using military language here because it felt like we were, it was a battle against the virus and a battle against time. Arm people with the right sorts of tools and equipment to be able to publish and broadcast from home. As well as that, we're very, very used to, as radio people and as television people, used to broadcasting in studios with the right sorts of environment around us. Literally, we actually had people, and I've got photos of them, people broadcasting from within their cupboards just because they didn't have the right sorts of soft furnishings around their room to be able to get and capture a good sound. We were very, very conscious of the changing terrain around the health orders. For some people who were broadcast critical, they could come into work. How we defined what their roles actually were and whether they were broadcast critical or not was a challenge. Having people at home presented a huge number of challenges with regards to editorial oversight as well as mental health challenges. And editorial oversight are things like having the right sorts of forums and robust discussions around what we actually call the virus too. And as you will know, the guidance from the World Health Organization right now is that we should not look at calling the various strains of the virus associated by country or by region, but to now use the Greek alphabet to refer to them. So just being able to roll that out effectively while people are working remotely can present some barriers. Many of our broadcasters aren't used to operating their own panels, let alone being able to record and broadcast from home. So being able to ramp up technical capability was absolutely a massive enterprise. And we had to form a fellowship of like-minded broadcasters, like-minded journalists who could actually provide us with their experiences. It's been really supportive to actually have forums such as the AIBD to be able to talk to others who share exactly these sorts of challenges from a staffing perspective, from an equipment perspective, from a changing health perspective, and from a journalistic perspective of people who are part of the story also needing to cover the story with, you know, on the one hand, children, elderly parents and the like being part of their own experiences. So really looking forward to being able to answer the questions that the audience and fellow panelists might have on the experience, but the SBS experience of being able to manage during COVID-19 has been positive so far. We're very, very fortunate that the pandemic has not, in Australia at least up until this point, we have not seen the sorts of numbers that others have around the world, but with outbreaks always just being a bit of just around the corner. And I note that Melbourne has entered into its 4th lockdown just last week with an outbreak. Then complacency is absolutely the enemy. I will just reiterate before I finish the point around mental health and well-being for our staff was something that was a very, very high priority. And that was because people did not have the right sorts of chairs. They were sitting on their kitchen tables, and they were physically reporting, tightness and being unwell, but also from a mental health perspective. COVID is a coronavirus which presents sickness in the lungs, in the heart, and in the body, but it has absolutely been significant in terms of the overhead and the concerns that it's provided from a mental health perspective as well. So wellness sessions, constant touching base with staff to ensure that they're connected has been a priority for us and has kept us broadcasting throughout.
Thank you very much, David. I assume that your presentation is yes, Dan. I mean, very interesting presentation, and especially I think we all face this challenge, especially in this part of the world, about the connectivity. And mental health issues are the most important, not only for those who are suffering from COVID-19, but also people who are covering and really witnessing so much that other people might not be witnessing. So, I mean, this is really key point. Now I will move towards Senthilji. And before I request him for his presentation, I would like to introduce him. So as our next speaker, Mr. Senthil Rajanji is Additional Director General at Doordarshan News. He has coordinated reports and stories for major events such as the Mumbai terror attacks in 2008, Asian tsunami in 2004, Kosi flood in Bihar, Gujarat earthquake in 2001, and historic Indo-US nuclear deal, among others. He is the recipient of several awards, including the Matashuri Award for television news. Senthilji would be talking about public service broadcasting during pandemics, India's perspective. Senthilji, mic is yours.
Thank you, Vidya, and welcome to India. I would like to thank all the other panelists also. I will just go through a very short presentation about what we are doing on Doordarshan, and then the presentation, as you see, if you are able to see the presentation.
Yes.
Yes. So as we had mentioned, the topic is public service broadcasting during pandemic and India's perspective. Just to give you a small introduction, I would like to introduce my organization, which is Doordarshan News. We are part of the Doordarshan family, which is India's public broadcaster. We are one of the largest broadcasting networks in the world. And just to give you an idea of the operations that we do, primarily in the news wing, we are focused on giving credible information to our viewers, and we run news bulletins. Primarily at the national level, we run two 24/7 news channels, which is in DD News and DD India. DD News is a Hindi news channel, and DD India is an English channel, which we recently launched, and it is also 24/7, focusing mostly on English audience and also for the international audience. In addition to that, we have 31 regional news units, which telecast in 22 languages. This is in all our state capitals, and they focus on regional bulletins because the diversity of our country is so huge, so that we ensure that there is complete information in all the available, in all possible languages that we can do in all the states. Then we also, since the COVID outbreak happened, our programming and news bulletins have generally been focused on ensuring dissemination of information related to all COVID work, and also the steps being taken to combat the pandemic. We are also doing out very special programs in terms of creating awareness. And all this, as we have all focused, we are taking steps to ensure that this happens at minimizing with the minimum risk of exposing our journalists. Safety of our journalists is one of the top priorities that we have given in our entire operations. Just to give you a small glimpse of what are the type of things that we do. One of our focus areas is like we have, as I mentioned, 2 24/7 bulletins which run through the day and night. And these channels, both DD News and in India, are aimed at giving timely and disseminating correct and timely information. In addition to that, we are also doing a lot of public service broadcasting in terms of spreading the message of encouraging COVID appropriate behavior and other do's and don'ts related to the disease, so that there is awareness created among the general public. We also do a lot of myth busting and countering false narratives, which is a big problem in the recent past since the explosion of social media. So we take very quick reactions, quick action to ensure that whenever there is a false story or a fake narrative, story being circulated in social media, we immediately have a special program or also do a special news capsule to counter that myth, so that there is minimum damage done due to such fake stories. We will also selling a lot of hope about, it's just not that since the disease has created a lot of havoc, our focus is also creating amplification of positive and good news. A lot of people are engaged in both the government and the public are also engaged in helping each other. So we do a lot of good news stories, which actually talks about champions who are actually working to help others in the community. The last part is about communication to the last mile, which I think is one of the important tasks of a public broadcaster, to ensure that all the news is conveyed to the last person on the ground. And for this, our entire network is engaged both in the news channel and in the news bulletin mode to reach out to the general public with very specific programs and also very specific campaigns. So just to give you an idea of the type of campaigns that we do, I'm going to we have 1 or 2 special programs which we do. This is one of the very specific programs that we started once the COVID outbreak happened. This is called Doctor Speak. This is a program which we have done very intensively over the last 1 year. And whenever the disease has peaked, we have in our country, then we have tried to increase the number of programs. In fact, currently, during this current second wave, we are doing 3 such programs during the day. This is almost like an extended OPD for the general public. We bring in the best consultants of our country to talk online. They take questions from the public to decide to actually address the public's doubts, also suggest treatment protocols. And as this is if you recall that the entire process of handling the COVID pandemic has been a very dynamic process with constant change in treatment protocols, vaccination strategies. So, and also earlier it was restricted to urban areas. Now there is a spread to rural areas. So we are also focusing on reaching out to the rural audience so that there is an awareness and education created through doctors so that proper treatment is given to the people who are affected by COVID. This has been, this is a phone-in program, live call-in program where people can call in. We also stream it on Facebook and the Twitter so that people can also join in on social media. And it is a very popular program. On similar lines, we also do a weekly Total Health and Arogya Bharat, which are also again focused on the same issues. Added to that, I would like to come to some of the important things as a public broadcaster. We have also taken it upon ourselves to actually propagate the message of public service messaging in terms of taking adequate precautions for public in terms of preventing themselves from COVID so that they are safe. And in this, we have actually aligned with the Ministry of Health and Family Welfare. Currently, we are promoting the Doordarshan. We have actually come up with a very specific campaign for the entire country, which is called Doordarshan Mask Up India campaign. So this is a special campaign which we have been doing for more than 6 months now, where we actually are advocating the use of masks. And as a constant service messaging, we are actually having a Mask Up India bug, which is permanently placed on our channel on both DD News and DD India, just to reinforce the message to the public that whenever you go out, or whenever you go out for any activity, please wear your masks and go step out of your homes. The other specific initiative which we took in the recent past is to further reinforce the message. We have actually asked our news anchors themselves while reading news wear masks and talk about the use of masks. So this itself is another message reinforcing exercise which we have done. And this is done across the entire network in all our regional bulletins, just to reinforce the message again that whether we are vaccinated or not vaccinated, but you still have to wear masks. So this is a very important messaging initiative that Prasar Bharati has taken and Doordarshan News has taken as part of this initiative. In addition to that, we are also designing special promos on vaccination and COVID appropriate behavior to be run on the entire network. It is in multiple languages. And this vaccination promos are run not only on the channel, but we also amplify it through our social media space. We have social media handles on Facebook, Twitter, on all our national channels and also on the regional channels. So there's a huge followership which we through which we actually reinforce this message of the need to get vaccinated and also the need to follow COVID appropriate behavior. We have also taken up, as you have seen some of the infographics on my screen, there are special creatives on COVID appropriate behavior, which has been designed specially for on the social media. And this is also circulated through social media. So this is broadly in the last, ever since the pandemic happened, Doordarshan has been very constantly engaged in actually catering to the need of the people to ensure that there is correct information, proper news dissemination, and also we are also actively participating in a behavior change communication through our public service messaging. So this is one of the important tasks that we have taken up. But all this we have emphasized during all these exercises that our focus has also always been on the safety of our journalists also. So we post-COVID, we have come up with new SOPs which for our telecasts, which include administrative changes, technological changes, and programming changes in the newsroom operations, which related to reporting, content generation, production, so that we keep our journalists also safe. So some of the administrative measures that we undertook since the break of COVID is that we have actually split our staff into batches so that we are treating them as bubbles, so that there is a group of people who come in a particular shift and they don't mix with each other, so that there is easy nature of contact tracing and testing and tracking. So we keep them in, we work in shifts. So each shift is a particular batch, which we do not mix batches. They come in a particular shift and go back home, so that in case there is a particular case in a particular batch, then we are able to replenish that batch with some other group. So we have tried to stagger our timings so that there is not much overlap and there is not much contact between one group and the other group. And as I had reinforced, we have been actively engaged in contact tracing, testing, and tracking of all our staff, so that if there is any case of COVID, we immediately take the necessary precautions. Apart from that,
I'm so sorry to interrupt, but we may like to wrap up in 2 minutes.
Okay.
It's an amazing presentation, and we really want to hear more.
Okay, so sure, just 2 minutes. Well, I've just got only 2 more slides. The other part is about work from home, which is related to editorial content and generation. And I would also say, with reference to this, basically, we have changed our programming technologies. We have changed a lot of programming happens on Zoom. Our live telecasts are not directly with DSNGs or OB bands. We do not have any guests coming to the studio nowadays. We only connect people from home, and it is done through Zoom or through WhatsApp or any other mode of connection which we can facilitate. We also have stopped, our reporters are all reporting from home. Apart from that, we have also taken additional care. Whenever there is a reporter going out on a field for a COVID-related story, we have also provided them with PPE kits, and they go with PPE kits for coverages. It is more of, we have tried and seen that our programming is in such a way, it is mostly live. We do almost 18 hours of live production, but all this 18 hours of live production is with remote broadcasting options as much as possible, and so that there is less risk of the exposure of journalists. So I think this is more or less what we have done. And over this last 1.5 months, 1.5 years, we have tried our very best to keep our journalists safe, and at the same time ensuring that the right information reaches out to the public. I think this is what I would like to say from Doordarshan. Back to you, Vidya.
Thank you, Suniti, for such an amazing presentation. And I mean, as you said, that reaching out to rural community is the most important thing at this point of time, and also wearing mask while reading news is one of the best ways actually to not only protect news crew, but also send out a very loud and clear message to people in a very effective way. So moving forward, now I would like to invite Vincent live from Phoenix Satellite Television, Hong Kong, China. Vincent is responsible for directing 24-hour live news and feature programs on Phoenix Info News channel. His major accomplishments include production of interviews with the chief executive of both Hong Kong and Macau, the live broadcast of the Policy Address Forum and US Presidential Election 2020. In 2016, he covered the Taiwan presidential elections. The topic of his presentation is Phoenix TV Contingency Plan under COVID-19. The mic is yours, Vincent.
Ms. Vidya? Okay.
I think we are having some trouble with connecting. Oh, yeah, he's back. He's here.
Yes, we're back. Yeah.
Yes, Vincent, please welcome. Mic is yours.
Hi, everyone. I'm from Phoenix TV, Hong Kong. Today is to share the experience from a contingency plan under the COVID-19. During the COVID-19 pandemic, a large number of overseas people returned to Hong Kong, which led to confirmed case increase significantly. As the global challenge is still ongoing, we are facing a high risk of manpower arrangement. If an employee is diagnosed with infection or suspected infection, it will seriously affect our daily operation, both live news and pre-recording programs. If we respond to the escalating outbreak of COVID-19 in Hong Kong, Phoenix TV has implemented some contingency plan to secure our operation as still normal under all circumstances. First, when entering to Taibo office, all employees are mandatory to wear face masks within our office area, and the body temperature measure is required once step in the office building. Also minimize the number of visitors to protect all employees from any unknown sources of infection. Sanitizer and face masks are provided. Meeting and overseas travels. All sorts of social gathering and face-to-face meeting are not encouraged. Web meeting and other communication tools are used instead. Overseas trips are not necessary. Reporter and hosts are required to stay at their own places. Some of the program recording or filming need to be finished with the help of other correspondent office and over 60 reporter stations across the world. Manpower allocation. Department of Health will announce a list of residential buildings with confirmed public case of COVID-19 reside. Human Resources Department will follow up the arrangement those colleagues who live in the same building to undergo a 14 days pay home quarantine. Meanwhile, they have required to conduct the COVID-19 test with a negative result before resume to work. In order to reduce manpower in office, Phoenix TV practiced some special arrangement. On-duty staff are assigned in different teams and arranged to work at a different workstation. For example, a special situation for the EFP department, they run as a split team, which some station at headquarters in Taibo, while some stay in town office in Wan Chai. Equipment needs to be allocated in order to fulfill the needs. Back office staff are allowed to work as a split team, which minimizes the manpower to complete tasks in office while others work from home. The sitting area is relocated relocated with a minimum of 1.5 meter sitting distance in order to reduce interactive among college. The program with 2 hosts are changed to single host instead. The face-to-face comment session are substituted by using Zoom VOV Tencent software, while other guests are doing online interview. Program schedule. Keep the production of all sponsor program. The pre-recording program with relative low timeliness and without sponsor have suspended production temporarily. Some program will be re-edited by adding some new topic to reduce the pressure on production. Shorten live program on air time and schedule more program to rerun. Diagnosed COVID-19 cases. If any of our colleagues have diagnosed COVID-19, their working area will be closed for deep cleansing immediately. And shut down your in-office won't affect the daily operation, as the network can access in any workstation, back up working area and prepare as well. For example, if production department has anyone infected COVID-19, a normal 24 hours in 3-shift duty will change to 2 shifts only. A normal 24 hours, which means overnight shift will be cancelled in order to save the manpower to handle programs during 7 o'clock in the morning and midnight. Yeah, thank you.
Svidya, you are on mute.
Thank you. Sorry, guys. Vincent, thank you very much for your presentation. And I feel your TV has really implemented SOPs, and I'm sure these SOPs have served well the community and the organization. I have some questions, and also I see many questions are being posted on the chat box. I will encourage our audiences to put more questions, and at the end of this session, we will definitely try our best to take as many questions as possible. But before that, now I would like to introduce you to our last speaker before we open this floor for questions and comments. Mr. Leon Willems was appointed Director of Policy and Programs of Free Press Unlimited in May 2011. His expertise include strategy development, policy implementation, and innovation. Willems initiated the International Coalition of Civil Society Organizations for the Safety of Journalists and led the advocacy to improve the efforts to monitor, report, and investigate threats to journalists as mandated by UNESCO. The topic of his presentation is Trends in Access to Reliable Information in the UN Development Agenda's Framework, globally and in Asia. The mic is yours, Leon.
Thank you so much, Vidya, and thank you and welcome to all of you. It is afternoon. We're still in the morning in Amsterdam. First, let me say a few things about Free Press Unlimited. We're a press freedom organization working in 40 countries worldwide, also in South Asia and Southeast Asia. We've been responding to the COVID crisis by adapting all of our programs. For example, we have been focused on supporting small and independent media in Africa through a EU-funded program. But we've also worked with partners in Pakistan, Indonesia, Nepal, Bangladesh, to see if we can assist in addressing some of the problems. But now let me share the presentation I have for you. It's focused on why does it matter, safety of journalists and access to information. First of all, I think you see my slide now, right?
It is visible, yes.
Yes. So, I think you all know there's a UN agenda for development, and it has targets for safety of journalists and access to information. And it's basically because the agenda of the United Nations is to promote peaceful and inclusive societies. And as part of that, there's a goal that's defined. One of the goals is to indicate what are the number of threats and verified cases of killing, kidnapping, disappearance, and terrorists, amongst others, media personnel. And the second is, what is the state of access to information? And we think that is extremely important because a literature study, but also in practice, we see that access to information is extremely important when you want to combat poverty and you want to provide equal opportunity for people that are marginalized, which is partly why we work a lot on gender inclusion. If you look at this slide and you see in the top, in the bottom dark green area, you see access to information there. But access to information is actually crucial when you talk about social protection and about equal opportunity. And these are the two things that generate government accountability. So what happened in the year of COVID worldwide? These are global stats, and I hope they give you a picture, because I try to limit my speech and give you a picture of what is happening. And then you see basically across the world an increase in attack against journalists, and also a lot and inhibitions to disseminate information. And then there's interviews that were done with journalists. This is a study that was done by ICFJ across the world. And you see how have journalists worked under the conditions of COVID. And you see there's a lot of people that feel uncomfortable, journalists individually. These were 3,500 journalists were interviewed for this study by ICFJ and the Tow Center. And you see that the physical, the physiological and emotional stress of dealing with COVID is enormous. Threats about unemployment, intense workload, a lot of social isolation. So there have been a lot of challenges. Now, this year, Free Press Unlimited has worked with partners in Indonesia and Pakistan to produce a report on how did access to information and safety work in those countries. And then specifically, for example, when you speak about violence, you see here the spreadsheet of our Indonesian Association of Journalists partner, who have noted 100% increase in attacks against journalists. And most of this actually happened on the basis of protests and how protest was handled in 2020. And this is something we see throughout the region. Street protests, demonstrations, and journalists were attacked either by police or security forces or by people in those protesting areas. The voluntary national review that was done by our Pakistani partner basically also noted there's been a lot of inhibitions on access to information. Legal issues where a government has blocked content, legal action against media outlets, also legislative action banning content, but also internet takedowns. So again, these have substantially increased in the last year. Then the economic challenges, which I'm sure all my distinguished partners from the broadcasters that spoke before me and who I have to recommend for their excellent best practices on how to deal with COVID on the work floor. You see that there's also an economic problem as a result of COVID. Enormous decrease of advertisement revenue. This is something we see globally, and enormous job insecurity. Sorry, I hit the wrong button. Job insecurity. 65% of the journalists across the world, this is again the study by the Tow Center, feel insecure about the economic prospect. So then the third thing we looked at was really inclusion and discrimination, because one of the things we see during the COVID crisis is actually that existing inequality has increased. And one of the most specific things we see, especially in Asia is the exclusion of women. These stats are assembled on the basis of a study we conducted in Malaysia. You see there that the number of men and women that are used as source on discussions on politics and government, you see the disparity. Men are only consulted as a source when it's about the economy, and women only figure even less than men when it comes to social issues, which this study concluded that 81% of the media in Asia can be typified as gender blind. There is not enough attention to promoting issues that matter to women, to have women working on issues, to be having them as a quote. And some of these highlights that I'm saying here, again, have been conducted also in other studies where one of the problems is that women journalists are receiving online threats and sexual assault. Sexual harassment takes place in the workplace. And it is also unfortunate because it's possible to do something about this. And this is something that I really want to share as a best practice. It's possible to strengthen women's decision-making and leadership in media organizations. It's possible to address threats and attack on women and gender-based stereotypes. There are methods, and we produced a study for the European Union on which concluded more than 100, 200 recommendations on how this should be done. Now, based on the research that we have concerning globally, but also as part of this UN development agenda, I won't read them all out, but
we are hearing some background noise. I would request if someone is, just check your mics if these are unmute. Thank you. Please continue.
Yeah, thank you. So one of the things we see, and we actually applaud that, is that the government of Sindh province in Pakistan has adopted a legal measure for protecting journalists. We think there should be more national protection mechanisms for the safety of journalists in accordance with the UN Action Plan for Safety of Journalists. We work closely with UNESCO on these efforts, and I would welcome all initiatives in that regard. We think governments should start working on the recommendations that are there by the UNESCO adopted plan of action for safety of journalists and the issue of impunity, especially when it comes to prosecuting and investigating cases where journalists have been harmed. In the social media regulation, we see, of course, because of the spread of fake news, there's been government attempts to try and provide legislation to combat fake news, which we think is needed, and social media companies should do much more in trying to prevent this from happening. At the same time, these legal measures should at some stage, hopefully when the pandemic is coming to an end, should be taken back again. And we recommend that governments include much more conversations with the media sector on how to work on these issues. In the VNR process, we see that a lot of the governments are producing reports to the United Nations without consulting the main civil society organizations, for example, journalist unions. This did happen in Indonesia. It did not happen as of yet in Pakistan. But we really think if we want to be serious about the increased threat to journalists and the level of access to information that is generally available, we see that the COVID pandemic has created some bad counter products that we should address. And we're always willing to work with you on that and try to combat that. So those are my slides. We look at the world as if we work together, and these are all the E's, everybody of us working together, we can make a better world. So thank you for your attention. And of course, I'm open to any questions you may have.
Yeah, of course. Thank you, Leon. I think this is great research and data, especially when it comes to media. I have realized that sometimes maybe we don't have enough data that can provide evidence that whether safety measures are being developed which are evidence-based, and at the same time, are they being then implemented? And what kind of results they are achieving, and especially when it comes to gender mainstreaming and inclusion. I have been receiving some questions. We have 15 minutes for that. I will go by the same order and request. I'm again sorry, hearing some background noise, and I would request to unmute your, mute your mics. So I would go by the same order, and my first question would be from David Hua, that media houses in some remote, in some remote regions may have limited resources or awareness about the risks health reporters face while reporting on COVID-19, but at the same time, they are on the front lines. So how more advanced media organizations can help them devise and implement health safety guidelines? David, over to you.
Sure, thanks for the question. I think that making guidance and just sharing learnings along the way as they're discovered, that would be really useful for everybody. Say, for example, best practice when it comes to recording interviews in the field with a boom mic as opposed to a handheld microphone, so that you're maintaining some social distancing. Sharing experiences, tips, and tricks of the trade, I dare say, would probably be important.
Thank you, and thank you, David. I was just checking whether I'm mute or not. And we have another question for Dilji from Pakistan, and Mr. Rahman Khan Lodi, Deputy Director of External Publicity Wing, Ministry of Information and Broadcasting, Government of Pakistan. He is curious that whatever Doordarshan TV channel has, the campaigns you have launched in different areas, have you done any impact analysis that can provide any evidence to other organizations and other countries that whether that is a best practices and they can also follow this suit? Santilji, please.
Thank you. Actually, I would just like to tell you that we have not done any direct study so far with reference to the impact. But what has happened is that ever since the pandemic started, Doordarshan had gone back to some revamping of its programming. And the very fact, basically the audience research measurement organization called BAR, which actually tracks the audience which watch the different channels. When we launched the programming during our lockdown in the first phase, we also done some special programming. We brought back 2 of our old serials, Mahabharata and Ramayana, and they record viewerships globally also. It was almost for 2 consecutive weeks, we had a viewership of 1.5 to 1.9 billion people watching us, which during that period, we were able to also push a lot of public service messaging. So I think our practices have actually helped us. And though I would not say we have actually studied, because we are in the process of conducting our impact studies, but our viewerships have generally grown during this period. And since a lot of people were under lockdown, we also introduced some special programs. I would like to add, some mention was made about psychological nature of the disease. So we also had some special sessions where people were given options to address their psychological issues. And we also had a special show for kids who were actually locked up at home called DD News Kids Time, especially targeted for kids. So which had a lot of calls. And as I told you, most of our campaigns were all call-in programs. And we have call-ins coming from not only just from the country, but also from abroad when we do these programs. So which shows that people are actually responding to it. And as I said, since it's a telephone call, my programming for the call-in programs is around 3 hours a day. And during those 3 hours, we get hundreds of calls on that for that program requesting doctors to address their issues, which shows that people are actually following those guidelines. And one more special initiative, since we were talking about journalist safety, we have also organized teleconsultation with our doctors for our entire Doordarshan news staff across the country. We are such, and Prasar Bharati, that is All in the Radio and Doordarshan. We are an employee base of more than almost running into thousands and different kendras. So we have had a pan-India 2 teleconsultation sessions specifically for our employees to address their concerns from doctors and psychologists. So this was a special initiative that we took to address the interests of the journalists. Thank you. You mute.
I hope it answers your question. And very quickly, we are running short of time, and so very quickly I would turn to Vincent Lai. So I was just wondering that your reporters are stationed at different locations around the globe. So how do you ensure they have appropriate equipment and training to follow the safety guidelines, especially in the less developed countries?
We did closely communicate with the reporters and understanding their needs. Most of the cases we will arrange to send all the necessary equipment to them from head office or nearby local office to save the delivery cost and time. Regarding the training, we are provided training by Zoom, or some cases if the network is not stable or take a long time, we'll pre-record the training section and send to them by email or WhatsApp or any other communication tools. Thank you.
Thank you very much. So now I will ask my next question from Leon Willems. I hope I'm pronouncing your name right. It's a little difficult for me. So,
it's fine.
Yeah, from your experience, I see that a lot has been done, and you have seen media organization from outside and maybe from inside too, and then how they deal with government and government deals with them. So different aspects of this. Do you think that media organizations are really doing enough to secure and make their correspondents, especially health correspondents who are not war correspondents, I mean, generally, are they doing enough? And is there any example that they are providing insurance to reporters who are really working or reporting from the front lines?
Basically, I think it is a mixed picture. We've heard David, Winston, and Santil say that they are actually practicing a lot of good practices on the work floor. I would like to bear in mind also the fact that an enormous amount of people that work in the journalism are freelancers, and they're not syndicated by a media outlet or by a journalist union. In most of the cases in the last year, we found that the journalist unions have not been equipped and resourced to provide these freelancers with protective gear. And so we work a lot in what we call media dark areas. So it's areas where the media have less penetration and there's less local media, like, for example, parts of Balochistan in Pakistan. So the minute you go out of the bigger public interest media, like the esteemed colleagues that are with me on the panel, you see that in the local and the smaller media houses and people who go in the field, that protective gear is less available, and that insurance is a common problem actually in the entire global system of protection for journalists. So I think that one of the problems that we see already in the last 10 years is that freelancers, because of the many economic challenges that media are faced with, basically because of the proliferation of social media and the fact that advertisement revenue has been siphoned away to Google and Facebook. And so the media are struggling to keep alive. And so more people are working freelance, have less protection, have less access to protective gear, have less protection from insurance. And so this is the common problem we have to solve, because we need good journalism to provide the public with good information and to steer away from the gossip channels and the fake news and the hysteria on the internet. But we can only do that if governments understand the need for investing in good quality journalism and ensuring that markets are fair and equal. Of course, we can do a lot if we want together by providing more protection. One of the recommendations throughout all the VNR processes that we got is, can the government, for example, not do more to protect journalists that are out in the field by giving them an emergency or a crisis status for vaccination, for example? Or can there be like a government program to protect journalists when they are reporting on scene? But of course, it's also a matter of the media houses, and some are doing the best they can. But in fact, I think everybody is struggling. The pandemic is something that has opened up areas where we did not know that we would need to be shielding ourselves from. I hope that answers your question.
Yes, of course. Thank you. As thank you. Definitely, it does. I'm just told that we have another question. So let me just see that this question is very important, and I'm trying to scroll down. Please bear with me because I'm just scrolling down in my window, chat window, and at the same time. Well, someone wanted to ask a very important question, but I see that that person is not here anymore. So I would really thank everyone, and I feel that this has been an amazing discussion. I saw Philomena is raising her hand. Okay, open. Yeah, over to you.
This has been a very interesting session. I'm not supposed to speak until the end, but I have a question because one of the things that Leon mentioned about insurance and people being contractual staff, and the way the media industry is suffering. So we gathered that there's very little that can actually be done, and there are no unions actually, so to speak. But one of the other things that really comes into highlight, a lot of journalists are actually, I'm talking about some countries where there's so many deaths, and you can see friends in your own office, journalists who are working there, and then other journalists actually, passing away. And this has sort of impacted a lot of people during this period. And I think psychologically, many people are affected, especially at the workplace. So my question is for Ismail, Leon, of course, the rest of you can chip in. How are your organizations handling this? The psychographic aspect of, the social, how do you call this? The psychosocial trauma that people are going through during this period, especially your co-workers. How do you handle that, Sendel?
Thank you, Philomena. On behalf of Prasar Bharati, I would just like to tell you two things. Just I had mentioned earlier, we are very concerned about journalists' welfare and the persons who are working with our teams. So we have ensured that, as I had mentioned earlier, personally intervened in this matter. And along with our Director General Doordarshan, we organized for the entire Prasar Bharati family 2 teleconsultation sessions. And these teleconsultation sessions had a doctor and also a psychologist. So we asked all our employees to join in. We had more than, both the sessions put together, we would have had around 600 to 700 of our employees joining online and addressing their queries. These were some of the people who had been impacted by COVID, and some who were not, but were working in the newsroom and other contents. And these sessions were focused on psychological issues, predominantly helping them address their, it was like a psychological counseling session for people who wanted to take questions. So this was a very specific campaign we done, especially after the second wave. And we have already done 2, and we intend to continue with these sessions. And now this is one. Second is about also to take care of the protection of our journalists. We have already conducted vaccination camps. We are being treated as frontline persons, and so the government has also supported us, and we have already conducted vaccination camps for our 45 plus people, and there is an 18 to 44 category people also. We will be soon getting a vaccination camp done in different states and also in our headquarters. Other than that, we also have we are constantly, as I had mentioned earlier, we already have also a COVID WhatsApp group, which is actually for people who are affected by COVID. And we are such a huge network that people have, it's a different, and such a huge country. So the WhatsApp group helps us in rapid response to anybody who is in need of any help. So immediately concerned nodal officers take immediate action to respond to the particular employee's concerns. These are 2-3 things that I thought I will flag in response to what we are doing.
Fantastic. Thank you so much, Sindhu. But I'm wondering whether there's any resistance from journalists themselves. Are there people who say that they don't want to come to work, or they're afraid that their colleagues are having COVID-19, so we don't know who's having it? So is there any kind of resistance? I mean, this is just a question for everybody, if anyone's willing to take that. Thank you.
No.
Okay.
From our side, I can only tell you, we have been very flexible. We have had very flexible operating procedures. If any person is, if at all anybody is COVID positive, either in a person personally or in his family, there has been a very strict protocol followed. He has been given immediate leave, and they stay at home and for the entire quarantine period. And if any other, there is also a very strict contact tracing procedure we followed, which we traced all the employees who had come in contact with the particular person, and we also kept them home for quarantines, home quarantines. And there is a very flexible attendance policy also, which we have put in place, so that as per it is not that anybody is forced to come to work. We have always taken into concern the employees' willingness, and accordingly, programming has also been streamlined in such a way that, though I must tell you that we are live almost 12 to 14 hours a day, but still we have managed it with minimum employees and without any much discomfort to any of our working journalists.
Thank you.
Philomena, do you have any more questions, or we can just move forward and wrap up this discussion, or you would like to have more questions?
This is a lot, Vidya. Thank you. I'm not supposed to interrupt, but I was just curious. Thank you so much.
No, that's wonderful. I think we hear a lot more interesting things. So in conclusion, what I realized that every region, every media organization, and every journalist has different needs. However, when it comes to developing safety guidelines, I mean, I have worked as a journalist for some time, and I see that especially these beats, health reporters, crime reporters, and other different reporters, they are not generally given that much importance that certain safety guidelines should be actually developed for them, and not only developed for them, but then it should be implemented. So the point is that maybe there is a time that different organizations who have more experiences, they can share their experiences through forums like AIBD and learn from each other and make the world a better place. With that, I would really thank you everyone for joining and giving great insights. It was really great honor for me to host this session. With this, I will conclude this session. Thank you very much. Bye-bye.
Photo, please.
Yes, please. Just a second.
All right. So 1, 2, 3. Check. And thank you very much. Thank you.
Finish?
Thank you. Thank you.
Thank you. Thank you. Bye-bye.
Thank you.
Thank you. So good to see all of you, Samuel, David. We were missing David. Yeah, I've seen you so much on LinkedIn, right? Yeah, thank you very much. And we move on to the sounds. Nabil, can you check on that? Move on to the next one. Okay, so the next session, of course, before we come up to the closing, is our presentation by our rapporteurs. So for the first session, we had Dr. Ismail Shah and Mr. K.C. Rabi, and both of them are here today to present their findings from the ministerial session. Dr. Ismail Shah is from the International Telecommunications Union. Dr. Shah and Mr. Rabi K.C. from Nepal. Can we have both of them on the grid, Nabil? Thank you. Hello? Right. Welcome, Dr. Ismail. That's a bright day in Pakistan, or you're in Pakistan?
Hi, Philo. Let me close the door so that you get a better video.
Okay, so I hope that you've been really welcome this Leaders Summit. So we've had so many speakers speak, and Dr. Ismail Shah and Mr. Ravi Casey will be joining us. Doctor, it's over to you.
Thank you so much. I think Ravi was supposed to present first, but if you want, I can share my screen.
Yeah, I think we've lost Ravi in the grid.
Okay. Okay, thank you very much, first of all, for this opportunity. And it was really nice to hear the vision of all the ministers. They really had very important points and important, I would say, insights to share of how actually they are looking at media, especially during the pandemic. So I have tried to capture, and of course, you can all comment on what we have in here, on the recommendations that they had. So let me share my screen. I'll share the file that we have. So my part is mainly related to the recommendations of.
My computer got stuck. I'm coming in there.
So the recommendations of each the ministers, I have tried to be more elaborate so that if they don't want these comments, they can take them out. So coming to the Honorable Minister from Malaysia, Mr. Dato Saifuddin, His Excellency Dato Saifuddin Abdullah. His recommendation was very, very in the beginning. In general also it's true, saying that we should have a balance between life and livelihood. Basically the lockdowns versus keeping the economic activity. From the media point of view, that should be selling hope, not fear. So really, that is something that is of very, that's of importance. Then he emphasized recommendation was to use media to effectively disseminate the right information. This was his next recommendation. And finally, he also talked about the use of media for raising awareness related to education, health, and other services. One good point that he also recommended was, even from the government point of view, that only designated people should actually disseminate the information, not everyone. About the vaccination, since there is lots of misinformation, and also there are several people who cannot be reached. So one of the recommendation is to use media for reaching out the people who cannot be reached. There was some information about some recommendation was social media, the use of that to convey the right information rather than having fake news. So this was the recommendation by the Honorable Minister from Malaysia. Is there any comment, or should I move to the next?
I think you can. I think Ravi Casey has also joined us. So
Okay.
both of you, yeah.
So he will talk mainly about the presentation highlights. So I'm focusing on recommendations. So coming back to the minister's recommendations, His Excellency Alhaji Mohammed from Nigeria, again he talked about the campaign, use of media for campaign to raise awareness about COVID. The other very important point, and it's very interesting, is that the government should provide waivers or moratorium in license fee, because the broadcasters and the media personnel are also going through very difficult times. Later on, you will see one of the recommendations that generating media content in these times is also difficult. So this was another one which is of great importance. He also emphasized the need for broadcasting live the press conferences of the task forces, and also the importance of broadcasting information in English, national language, English wherever it's applicable. In Nigeria, it was applicable. National languages and other regional languages. Similarly, again, he emphasized the need for vaccination So it's the second minister who talked about vaccination. And he also suggested like kind of the use of, their fake news is mostly on social media. So he was of the view that both the broadcast media as well as social media should be used to combat that. Finally, we had, so any comment on that? I can move on. So then we had the minister, His Excellency Dr. Hasan Mahmud from the broadcasting. He talked about the media's role between and within the country. So coordination and all these other information exchange within the country as well as with different countries because of the different variants of the COVID-19 virus. Finally, he raised an important point, and maybe media can also play a very important role, that the human beings are not the masters of the planet. It belongs to every other species, and we need to convey this information, have awareness about how do we consume the resources, how do we use the resources on this planet. Finally, the third point that he raised was about mechanism of coordination again between and cooperation, so that the latest and correct information is conveyed to the people. And he also, this is a point that is coming again and again, and he also emphasized that the social media platforms, we need as AIBD or members of AIBD to contact the social media platforms collectively so that they combat the fake news. Then we had a good presentation by His Excellency Dr. Sok Prasith from Deputy Minister of Information from Cambodia, and he emphasized the role of all sorts of media, TV, radio, as well as social media, and he emphasized one important point that was related to the lockdown. So he said that this information about the lockdowns should be conveyed to people so that they are best prepared and they don't go out unnecessarily. Again, collaboration was another part, fake news was another part of his presentation or his recommendation also. In addition, he mentioned the work done by AIBD and also about the other institutions, the AIBD's work, for example, Angkor and anti-fake news initiative that AIBD has, that should be publicized more. And he also emphasized that the workshop and conferences that are conducted, as well as the university research that is conducted on awareness about COVID should also be made public and should be publicized. Finally, the last minister who spoke was from Philippines. Again, very eloquent, because as was introduced, his introduction mentioned, he is from the media, so he has been an anchor. So really, it showed actually that he was an anchor, spoke very well. So he mentioned that media is an essential part now of everyday life and should be supported by the government. He also mentioned that traditionally broadcast media has been one way. There was very little way of feedback, but social media has changed that. But it doesn't mean that the broadcast media is not important, because broadcast media we find very little or fake or misinformation. They are mostly authentic news, whereas on social media there is this possibility. This is another important point. He mentioned that it's very difficult for journalists and media personnel to create content in these difficult times, and they need to be supported by the government. In the virtual meetings, briefings, that was also emphasized by him and recommended that should be carried out in this time of pandemic. Another recommendation that I could gather from his talk was about a radio broadcast that can continue for 24 hours, disseminating pandemic-related authentic information. Another recommendation by him was to have short videos, because you see people have a very short span of attention, short videos to create awareness about pandemic and many other issues. So that was the recommendations by each of the ministers. Then we have some question answer sessions, and as a summary, I think the three topics that came out was countering fake news, supporting media through license fee waivers and other kind of initiatives, and the use of broadcast as well as social media effectively to create awareness, announcements, and accurate information. And then, of course, there was a question and answer session where the questions were answered very eloquently based on how the media can be used to be used for economic uplift, and they were answered by Malaysia and Cambodia. Thank you so much, everyone.
Thank you, Dr. Shah. That was indeed a very concise and interesting outcome from the session. But I think Mr. Ravi Casey has some more to add on to this. Ravi from Nepal.
Yeah.
We're waiting to hear you.
Yeah, thank you, Philo. I have taken the points and insights shared by the minister in this ministry talk. All the honorable minister highlighted that media played a big role during this pandemic. The government, private, and community broadcast organizations stand together and work with the ministry for dissemination of information related to this COVID-19. The major challenge faced by all the countries was fake news. You can see that each minister highlighted on this. However, there were the certain measures taken by each country. Let's say for Malaysia, it's good that during this COVID, they have their Malaysia official COVID-19 channel TV1. So they converted one channel to especially on this COVID to broadcast the program related to COVID-19, like press conference, talk show, and PSA, and etc. They also launched the Barita RTM on 26 June 2020 to provide the factual and verified news. Again, this was related to fake news. And they introduced this COVID-19 SOP for the media organization. I think it helps a lot for this media organization regarding this COVID. They are also disseminating information regarding COVID-19 vaccine through the various platforms like radio, television, billboard, public transport, social medias, and more. And Honorable said that they need a strong collaboration between public and private sector. Definitely, it is needed. On regards to Nigeria, the Honorable highlighted that after the breakdown of the pandemic, special presidential task force COVID-19 was formed, which imposed like lockdown, travel ban, mass gathering, and other measures. I think it's helped a lot during this COVID period. And the other good point was during this, definitely there was the financial crisis during this COVID period. So some debt relief packages were given to the media organization to encourage them more to be active during this COVID period. Again, they also face this fake news during this pandemic. So they they need to check this fake news from their broadcast organization, and they do broadcast through their official channel. On regard this Cambodia, again, during this time of the pandemic, Cambodia, all this media organization, and they said that Ministry Apps Department work hard to disseminate the factual news to the public. And again, this Cambodia, they also had the problem of this fake news. The ministry conducted a series of national, international, and seminar, workshop, and training for the media official and journalists to report the factual news. They also received the world appreciation for this containment measure against COVID-19 pandemic. Now they are focused on creating sustainable content industry, which also include COVID awareness program. On regard to Bangladesh, Honorable highlighted that according to WHO, Bangladesh was ranked in the first in the South Asia and 20 in the world during this combating COVID-19. And all the media organizations worked together with the ministry and promoted protective measures prescribed by the government of health department. That's why he said that it's what very good in this Bangladesh during this COVID period. Their economic also went up. Their GDP was positive during this COVID period. He further said that media can provide a unified platform for all public health communication, comprehensive health education guideline, and robust social distancing strategy while still maintaining the social connection. He also further highlighted that during said that in the future there might be another pandemic. So we should all know how to use media for this better practice. And again, he was also affected by the fake news. So finally, he said that there are many fake news in social media. So he said that can we coordinate with this social media service provider? They also have some responsibility on this news. So hence, by using social media, people cannot be misled. On regard to Philippines, Honorable said that media had played a very important and vital role in raising people knowledge and awareness. And what he said, the daily brief news 24 hours program related to COVID were broadcasted through their radio, television, website, and their social media. And to promote the national vaccination program and make sure the minimization of the impact of the COVID-19 pandemic to their community, they have developed the VAX planner series intended to provide the factual information on the different action on the government regarding community vaccination and different COVID-19 vaccine and the COVID-19 overall genre. So this was my finding from this ministerial talk. Thank you, everyone.
Thank you, Dr. Ismail Shah, and also Rabi Casey. Now, that's really, really insightful sharing that both of you gathered from the outdoor session. And even as we talk, I'm seeing the chat which says that governments should actually look into providing protective gears and PPE suits to journalists. So this is something that perhaps those who are present can think about. But even as we talk, we hope that most of the population will get vaccinated, especially media being the frontliners. Okay, we will be sharing these findings with all our member countries, and also those of you who are present. You will be getting a copy which will be on our website. So thank you to our rapporteurs for the first session. And now I move on to the second session one, actually, the beginning, devising safety guidelines for media practitioners during the pandemic. And so we have Janardhan Vista from Nepal and Ms. Ugoma Koki from Nigeria. So can I have both of you on the screen, please? Janardhan Vista from Radio Nepal and Ms. Ugoma Koki. We'd like to see your report on this session on devising safety guidelines for media practitioners. Ugoma? Ugoma, you're on. Thank you. Ugoma is from Nigeria, and Ugoma follows us quite widely on a whole lot of programs. So if Ugoma, you're ready, then we are. Share with us the outcome. So do we have Ugoma on the screen?
Yes, I'm here. Good morning and well, good afternoon, everyone.
Go ahead.
Can you hear me?
Share with us? Yes.
We had 4 speakers in the second session, and when discussing devising safety guidelines for media practitioners during the pandemic. And the first speaker was David Hua, who talked about COVID-19 responses from SBS. And some of the things he said he did was producing an enormous amount of content across different platforms. And they also, that he said that complacency is an enemy that should be dealt with, and also said that wellness sessions should be conducted for staff to reduce the problem of COVID. And then from Mr. Senthil Rajan, his topic was public service broadcasting during pandemic, India's perspective. And he gave a rundown of some of the things they did. And part of it was the dissemination of correct and timely messages, encouraging COVID-19 appropriate behaviors. They countered myths about COVID. They also developed special programs and campaigns. An example he gave is the one on Doctor Speaks. He also said they tried to increase programs, and they also expanded OPEDs for the general public. Another thing they did was to bring the best consultants to talk online and take messages from the audience. There was also message reinforcement. There was propagation of the use of masks, and also making news anchors wear masks and talk about it. There was also special promotions of vaccinations. He also talked about them following COVID-appropriate behaviors. They also did behavior change communication through public service messaging. They also emphasized safety of journalists. He also said they staggered timing for staff. There was also proper and periodic sanitation of the newsrooms. There was provision of sanitizers, and there was social distances when he was talking about what they did administratively. He also said they made staff to work from home so that they can keep journalists safe. He also said they ensured that the right information reached the public. They also changed some of their programs to accommodate COVID issues. He also said there was online connection of reporters from home. There was also online production to reduce manpower. They also used e-flyers for office work. And then there was connection of anchors from home via online link. For Mr. Winston Lai, he spoke on Phoenix TV contingency plan under COVID-19. And some of the things he said was that they developed contingency plans. They took body temperatures. They minimized visitors. They also provided face masks. There was some sort of reduction on overseas travel. They conducted a COVID-19 test. They assigned staff in teams to minimize physical contact of staff. There was also pre-recording of programs with selective load timelines. Programs with 2 hosts were also reduced to accommodate, to take only 1 host so that they can reduce people physically present. And there was also the introduction of online interviews. For Mr. Leon Williams, who talked about trends in access to reliable information in the UN Development Agendas Framework, globally and in Asia, he said that access to information is important for social protection and equal opportunity. He spoke on how they worked with partners in Pakistan. He said there was voluntary national review that showed lack of access to information based on the research they did with Pakistan. And they identified economic insecurity as a major issue for journalists. He said they noticed that men were only consulted as source when it comes to economic, political, and governance issues, and that no attempt was made at prioritizing issues that matter to women. But hopefully, he said it is possible to address threats and attacks on women and gender stereotypes. He also said that the government of Sin adopted a legal measure to protect journalists. He gave some recommendations, and they include that legal measures adopted in Sin should be made a national protection mechanism by the whole of Pakistan. He also said government should hold more conversations with media sector on how to work on these issues. He also said during the question and answer session that good journalism is needed to protect the public, and that there was need for government to invest in good journalism. Finally, he said that government has to do more to protect journalists, like giving them crisis status. That's the much I took. Thank you.
Thank you so much, Ubama. I think we have to thank you for doing this alone, because I just understand that Mr. Bista has had an emergency, so he's not able to join our very comprehensive report, looking very, very closely at all the recommendations and insightful conversations that were shared by our speakers in this particular session on safety. And I think this is so vital, because even as I speak, I hope Mr. Leon is still with us. We're hoping that AIBD could actually devise some safety guidelines for media practitioners. And I think you pointed out that pandemics occur all the time, or it can occur again, and we need to be better prepared. And not just pandemics, but disasters and any other kind of safety, right? So thank you so much to our rapporteurs for today, and also to all of you for staying with us this long. It's been, we started at 2 Malaysian time, so it's already more than 3 hours. And I'd now like to call upon my team, the AIBD team, who have put together this first day and second day. You'll be having more things that you'll be seeing tomorrow. We start at noon. And so we would like to invite all of you to be present again, because we have some really interesting conversations that's going to be very, very helpful and important for the media fraternity. But first here, I would like to call upon all the AIBD team who put together this 2-day Leaders Web Summit. And this is not a small summit. This is something that we've been preparing for the last 3 months. And I take this opportunity to thank all my colleagues and especially Miss Lisa and Miss Monica, who are the prime people behind this. And of course, Nabil and Krishant, who has been on putting everything together, adding the glitz and glamour. And also to Miss Vasuki, who's been sending out letters even this afternoon as we were talking. Some of you were not able to get through to us and still doing this. And to Miss Angeline and to YK and to Prashant for putting videos together. The TV AIBD video, of course, that was shown earlier was Nabil. He's a television man, so he came out with the montage. Thank you, Nabil. And also to Miss Ayn and the rest. I hope I didn't give any one of you. Miss Lee Laime, she's my Chief Compliance Officer and my assistant who has been looking at everything very carefully and making sure everything goes on well. And Vicky and Kalai, who has been the timekeeper as well. I don't see her on the screen, but she's the one who has been checking on the time. So I'd like to say thank you to the entire team of AIBD. And thank you all for working so hard without lunch, I'm sure. And now it's time to relax. And we'll see everybody tomorrow at noon. We'll be back with an even more greater, outcome, I hope, with the rapporteurs and so forth. Thank you, everybody, for your comments, and thank you to the team that I'm at here. Thank you. Goodbye, and stay safe. See you tomorrow.
Can we have a group photo?
Yes, of course, Nabil. Maybe the audience as well. We have such a good audience.
Yes.
So we should take the photo.
Krishant, if you can promote yourself, if you accept my offer to be promoted as panelist. And after that, I will promote all the audience who are still with us, so we can have a nice group photo.
Yeah.
Okay, Krishant, can you turn on your camera? Perfect.
He can't show his face because he's too handsome. So that's Krishant for you. He's the guy who put in all those slides and everything. Thank you.
All right. So perfect. And 1, 2, 3. And now I will be promoting all the audience to our grid, and according to your convenience, you can turn on your cameras. Just bear with me because I have to manually add everyone to the panel. Meanwhile, if anyone has something to say, then freely say.
Okay. Thank you, Raman, Asya Raman Khan Lodi from Pakistan. Thank you so much. Thank you, Deepak Joshi, for joining. Thank you, Ashok. Mr. Jankolal. Dr. Kiran Bedi is with us as well. She'll be joining us tomorrow. She's a moderator. We have a celebrity moderator, we said. So Dr. Kiran is here. Afifa from Bangladesh is also here. Thank you, Afifa. Thank you so much, Chamnan and Chan Vivad, right? Thank you, everybody. You have something to, you can say it now. Ugoma, you're looking lovely. Thank you.
Thank you. Thank you.
Did she hear me? Thank you. Thank you, Mr. Humayun.
Thank you so much.
Thank you, everybody. I hope you enjoyed it. We'll see you tomorrow.
Yeah, still there are some people left. So I am trying as fast as I can. Meanwhile, I will also share the agenda for for tomorrow.
Yeah. We can see Miss Ayn Osman is the only one with the screen behind her. So she is not only quantum but also a very good IT person. Nice, Ayn.
Krishant, if you can share the agenda for tomorrow. Yes, possible. It's a tedious task, but anyway.
Yeah. Who is calling? Just 1 second.
There were some very good comments that you made. Where are you from, Mr. Bhutan or Mr. Jankolai Gangti?
From Shillong.
Yeah?
From Shillong, India.
Sri Lanka.
No, Shillong.
Gangte was one of our participants for prisoners children's workshop. The script writing.
Okay, fantastic.
Yeah. I'm from Shillong, northeast part of India.
Yeah.
Oh, okay. I haven't been to that part of India. I should. But we can't travel, huh? So we're all stuck. So I'm also, like all of you, we're meeting everyone only virtually. Mr. Nazi, thank you from Cambodia. Thank you. So nice to see you again. Yes,
Thank
very
you.
good question.
Thank you very much for everyone. Thank you.
Thank you, Mr. Nazi.
So we meet again tomorrow?
Mohammed will be our rapporteur for tomorrow. Thank you, Mr. Sadiq.
Thank you.
And Tanya. Tanya has been very active.
All right.
Thank you.
So I think everyone is here. And okay, so now I'll just stop sharing the screen and all right, so if everyone can turn on their cameras. So we have 2 walls. All right, perfect. So on the count of 3, 2, 1. And for the second wall, no one knows who's where. So just bear with me. So 1, 2, 3. Thank you very much.
Thank you.
See you tomorrow.
Thank you. Okay. Thank you. Thank you. Have a nice evening. Goodbye.
Bye.
Thank you, Tanya.
Oh, Mr. Alexi is also here. Okay. Mr. Kim, Dr. Kim is also here.
Why everyone is so quiet?
Discipline. They are disciplined children. Disciplined participants.
Okay. So we are still here. So just in case if any last comment, anything.
You, Mr. Chanman, tomorrow 2 p.m. which is Cambodia, what time? 1 p.m.
Yeah, Cambodia is 1 hour behind.
Yeah, Mr. Chaman, 1 p.m. tomorrow. See you. Come in earlier.
So how did the session go?
Good.
I think audience can
go, eh?
Yeah.
Hey, Dr. Kim, how are you? You okay?
Dr. Kim, you're on mute.
Glad to hear you're okay now. Okay.
Yes.
Everything's fine now, right? Okay.
Right.
Right. Okay, perfect. So I think we can end the session. So thank you very much and see you tomorrow, because tomorrow we are having information-packed sessions. How many?
Okay, from 12.
Four sessions.
Sorry, it's not from 2 o'clock. Tomorrow is from
12 o'clock.
12 o'clock.
Yes,
I'm sorry,
so,
Mr.
yes.
Cameron, after I'm going to
Yes. So Malaysian time, it will be from 12 to 5:30.
Yeah.
And there will be 4 sessions, and with so many media leaders, media pundits, media gurus, media intelligentsia. So thank you very much. And with that, I will just share the video one more time of TV AIBD, and thank you very much.
Bye-bye. Thank you.
Thank you very much, Ms. Asia. See you tomorrow. All right, so I think I should end the session now. So bye-bye. Have a nice evening.
Bye-bye.